sir.
Thank you. Your next witness.
Your Honor, the state calls Dr. Ellen Reimer.
Hold a moment, ma'am. Ma'am. You witness, right? Raise your right hand. Left hand on the Bible. Do you affirm the testimony about to deliver before this trial shall be the truth so help you God? Yes. Take a seat in the witness stand. Adjust the microphone if you have to. State your name again for the record. Spell your last name.
Yes. Hi. My name is Dr. Ellen Reimer, R-I-E-M-E-R.
How are you doing today?
I'm doing fine, thank you.
I'm going to go ahead and get right to it. And if you would, just tell the jury a little bit about your education that led up to you becoming a physician, please.
Yes, okay. Well, I graduated from medical school in 1997 with a Doctor of Medicine degree. Following that, I did a residency in pathology at New York Presbyterian Hospital, Columbia University Medical Center in the city of New York. Following that, I did a forensic pathology fellowship at the Office of the Chief Medical Examiner of the state of Maryland. Following that, I did an additional fellowship training year at Johns Hopkins Hospital, Johns Hopkins University School of Medicine, also in Baltimore. And I am board certified in forensic pathology and anatomic pathology. After I completed my all my education and fellowship training, I took my first job as a forensic pathologist at Wake Forest University Baptist Medical Center, Wake Forest University School of Medicine in North Carolina, where I remained for almost 6 years. But before being recruited by the Medical University of South Carolina in Charleston, where I've been for 14 years as a forensic pathologist.
All right. And at the Medical University of South Carolina, you said you're a forensic pathologist. Do you have any professorship or teaching responsibilities there?
Yes. So I have also the title of Professor of Pathology and Laboratory Medicine. And because Medical University of South Carolina is a teaching institution, I am responsible for educating physicians in training as well as medical students, and that's an integral part of my job. So a lot of the work I do is observed by students and trainees.
And you mentioned you had some board certifications. Can you tell those to the jury, please?
Yes. So, you know, in order for somebody, there's the American Board of Pathology is the organization that certifies specialists in different fields, and well, the American Board of Pathology certifies specialists in pathology and requires them to take very long examinations and demonstrate and pass those examinations. And you can't just sit down and take them. You have to have achieved, gotten through your residency training and fellowship training as well. So I managed to do all of that. And I'm board certified in forensic pathology. Yes.
And do you have any membership or involvement in any professional societies that are relevant to what we're talking about here?
Yes, well, I'm a member of the American Academy of Forensic Sciences, and I also am responsible for editing journals. I have various academic responsibilities as well.
Right. And you mentioned editing certain journals. Have you published in the field of pathology over the years, given your professorships and your education
Yes.
expertise?
Because I'm interested in, educating the medical community, I published close to, I don't remember the exact number, but approximately 30 publications in the fields of pathology and forensic pathology. And this is also something that's valued at an academic institution, so you're not just practicing, but also contributing to the body of knowledge in your field.
Over the years with this experience, have you had call to conduct a number of autopsies?
Yes, so the principal responsibility of my work is to perform autopsies on deceased individuals in order to determine the cause and manner of death. And over the course of my career, don't keep exact track, but I estimate that I've done approximately 5,500 autopsies.
5,500?
Correct.
All right, we'll talk more about what an autopsy is in a minute. Over that course of time doing 5,500 autopsies, have you been qualified as an expert and testified in courts of record in the nation?
Yes. So, again, I'm not keeping track of every single one, but a conservative estimate would be approximately once a month for more than 20 years, which would put me in the mid 200, so about 250, but that's probably a little bit more than that.
And that's times you've been qualified as an expert in forensic pathology?
Yes.
And is that just in South Carolina or have there been other places?
Yeah, the majority have been in South Carolina, but also North Carolina, where I practiced for 6 years prior to moving to South Carolina. And I've also been admitted as an expert witness in forensic pathology in federal court a couple of times, where I autopsied individuals who died on tribal lands.
Your Honor, this time the state would move to qualify Dr. Reimer, Professor Reimer, as an expert in forensic pathology.
No objection, Your Honor.
She's so qualified.
All right, Dr. Reimer, before we get to your specific findings in this case, can you quickly describe to the jury what is pathology and what is an autopsy? What is it that your science and being a physician, what are you trying to do?
Yes. So the purpose of an autopsy is to obtain as much information as I can from examination of the tissues of the body in order to come to a determination of the cause and manner of death. And the autopsy examination is basically a specialized surgical procedure. It starts with an external examination, so before any cuttings get started, I look from head to toe. I look for anything unusual. If there's injuries, I review them. I look at them carefully and document those findings, as well as establish an opinion on how injuries may have occurred.
And obviously, because in cases where you have traumatic injury, there's no getting around the fact that it's very graphic, the things that you have to look at and the things here today that you have to describe to the jury.
Yes, that's just part of it.
Did you have call in this particular case to examine the victims of these murders, Paul Murdaugh and Maggie Murdaugh?
Yes, I have the name is Margaret Murdaugh. I know she goes by Maggie, but Margaret Murdaugh as well as Paul Murdaugh. I performed the autopsies on both of these individuals.
All right. And do you recall what day that was?
I'll have to refer to my notes. Both of the autopsies on both Paul and Maggie were performed by me on June 10th, 2021.
And is it typical when you're conducting an autopsy that you have assistants there that assist you in performing these procedures and that sort of thing?
Yes, so I have assistants to help me with whatever I need, and the autopsies, I do the autopsy, and any assistance I need is done under my direction.
Sure. And then is it common that photographs are taken of the various injuries and your various findings as you do the autopsy?
Yes.
All right. And if any physical evidence is recovered during that autopsy, is law enforcement present or some official there to take custody of those sorts of things?
They're not always present, but if they're not present at the day of the autopsy, they'll come back, and I seal all of the evidence up and with in secure bags, and then those are transferred to the appropriate investigator.
Well, let's go ahead and get to it, and we're going to talk about Paul Murdaugh first, okay?
Okay.
And we also, do we have some poster boards behind you? And the first one is marked as States 500. And can you explain very quickly what this is to the jury, please?
Okay. So you may have seen these kinds of diagrams. These are blank body diagrams, and so when I autopsy a man or male, I start with that diagram, and it's basically a vehicle for me to take notes during the autopsy so I can incorporate findings into my final autopsy report. But this is not, something that, this is really for my edification, and so I can write things down, and it helps me when I write the autopsy report to make sure I've covered everything.
And will this assist you as you explain to the jury the injuries that the two victims suffered?
Yes.
Dr. Reimer, let's again, starting with Paul, if you could very quickly, how many, did you observe any gunshot wounds to Paul?
Well, actually, there were 2 shotgun wounds, so that's different than a handgun, or so a shotgun is where there, there's basically pellets that are enclosed in a wadding, and the wadding, after it's fired from the shotgun, kind of opens up and allows all these pellets to be released from the wadding. And so the features of his injuries told me in no uncertain terms that he was shot with a shotgun.
And if I could ask you with the court's permission, if you could step down. I'm going to hold up this board, and if you could bring a marker with you. I've got a red Sharpie right here if that helps you. And let's talk about the injuries that you observed to Paul Murdaugh. And then if you could, for the jury, if you could draw on this board that the first shotgun wound that you observed on Paul.
I'll use my markers.
All right. Let me put mine up real quick.
Okay. Okay, so in order to make things as clear to you as possible, I'm going to use a black marker for an entrance wound and red for exit, okay? So just arbitrarily. Okay, so Paul had 2 shotgun wounds. One of them was to the left side of the chest, approximately this location. And the wadding containing the pellets traveled beneath the skin through like the soft tissue of the left side of the chest. It didn't actually go into the chest cavity, but traveled beneath the skin and through the muscle and fat before exiting the left axilla. Okay, so it's kind of a straight, kind of right to left shot. And
just real quick, when you say right to left, you're talking about Paul's right to left.
Yeah, that's right. So I'm always thinking about like the patient's right to left. Okay, it's not, if we look at it, it's from, would be from left to right. But we always, for consistency, it's always relative to his body.
Down here by the hands, could you put an R on one side and an L on the other, just because I know I get confused?
Yeah, no, it is. And honestly, we all do this during autopsies as well, because especially we have the back, and it's very easy to make a mistake.
And also, just real quick, could you write Paul up at the top there? All right, thank you. All right.
Okay.
All right, so you were talking about that first shotgun wound to the chest and where it exited. Were there
Yes.
any other injuries associated with that? Please continue on.
Yes. So remember we have wadding enclosing pellets. The wadding actually got stuck, didn't completely exit and continue to fly out. It got stuck right underneath the skin of the left side of the chest, like close to the armpit area. And we have a photograph of that pink wadding that remained in the skin of the exit wound. From there, multiple of the shotgun pellets started going through like the left arm, okay, starting from the underside of the left arm. So the wadding terminated in the skin, and then pellets kind of went out and went through the left arm. Okay, so this is the left, remember this is his left side, his left shoulder, his left arm. And then we've got a bunch of exit pellet wounds on the left side of the arm, and some also a little bit on the back. So that you can see this is going through, and then this is actually on the inside of the arm, and the exits are kind of on the left side. So,
Was there any stippling associated with this particular wound?
yes, okay, so there was stippling, and I'll draw that over here, okay? So when a projectile comes out of the barrel of a weapon, be it a shotgun, a handgun, an assault rifle, what propels that projectile, we call, projectile out of the barrel of the gun? Okay, it's gunpowder, and gunpowder is basically ignited through the action of the shooter on the gun, and so gunpowder is basically burning and projects the projectile out of the barrel of the gun. A projectile can potentially travel a very long distance, like many feet, or yards, or long, depending on the projectile, until it hits something. Or if it doesn't hit anything, it could eventually use power and go to the ground. But the gunpowder that leaves the barrel of the weapon can travel not too far. It only travels about up to 3 feet, depending on the weapon. So in this case, we actually have some particles of like abrasions from particles of gunpowder. And this is called gunpowder stippling. Okay, so we have stippling, which indicates that this wound was fired at a fairly close range. We can't say exactly, but probably no more than 3 feet, because that's our standard. Could be anywhere from 2 to 3 feet. And interestingly enough, there was some markings on the edge of this kind of cookie cutter type of defect from the wadding going in that shows that some of the petals of the wadding are beginning to open. So this is very classic for a shotgun entrance wound, and at the autopsy shows that it went, after going through the underneath the left side of the chest, it went through the left arm.
All right. And let me ask you this, and before we look at some of the pictures, which are very graphic, is that correct?
Yes, it's just the nature of the beast.
Okay. If this particular injury, was it immediately fatal?
No, amazingly enough, this really, if that was all he sustained, he would have needed medical attention and some stitches and irrigation of the wound to clean it out, make sure it doesn't get infected. But it actually did not pierce the chest or cause any internal bleeding. It did, however, cause a bruise or contusion of the left lung, and that's because there's a lot of energy associated with this, but didn't actually go through the ribs, but caused a contusion of the left lung. But he would have been expected to continue to be standing after this. It would not have sent him to the ground.
All right. If you could, there's a dowel stick over by your witness stand, and I'm going to make sure the jurors down here could see what you're talking about. If you could grab that for me real quick, and then we'll look at some of the pictures here.
Okay, what do you want me to do?
Well, I just wanted to show it to these jurors down here just to make sure they could see what you were doing. And then if you could just stay standing for me, I'm going to give them a good real quick, Dr. Reimer. All right, Dr. Reimer, if you would be very careful to keep these pointed this way if you could, but I'm going to have you just look through states 478, 479, 480, 481, and 482, and see if you recognize those images.
Okay. So these are photographs.
And just real quick, just tell me if you recognize them.
Yes. I recognize all of them.
All right, and these images that were taken during the autopsy you conducted of Paul Murdaugh?
Yes.
All right, and would they assist you in explaining the injuries to the jury?
Yes.
All right, Your Honor, this time I've moved states 478, 479, 480, 481, and 482 into evidence.
No objection, Your Honor.
Admitted without objection.
All right. Now, Dr. Reimer, if you get the dowel stick and come around here to this screen, I'm going to put this first image up on the Elmo, and then if you could, we'll talk about these injuries and describe them to the jury.
Okay. So we can see it's not great focus here, but this is the entrance shotgun wound on the left side of the chest. His left nipple is over here, so it's the left side of the chest. And there is some stippling
And
around
Dr.
it.
Reimer, I apologize.
Okay.
If you could come around and work this way so that all our jurors who are that way can
absolutely.
see.
Okay.
Awesome.
All right. So the shotgun wound is going in this direction. Remember, it exited that left side of the chest and then continued through the left arm. So that is a photograph of that wound, to the shotgun wound to the chest.
All right. And we'll see some more close-up images here in a minute, but this is the entrance wound right here, is that correct?
Yes.
And then we have some injuries right here. Is that where those
Yes,
petals exited
that
into
is
your arm?
where the wadding, which is the plastic piece enclosing the pellets, terminated in the skin. It just didn't manage to get out. But all those pellets kind of got released from the wadding and went through the left arm.
I'm going to move, that was states 478 for the record. I'm going to move now to states 479. And what is this image?
Okay, so this is a more close-up view of the entrance wound. And you can see that it looks like there's little, almost squares or pegs sticking out of the edge. And that tells us that the wadding is starting to open, because it opens up, it kind of opens up, there's petals. And this is a classic. I could put it in a book to say that this is consistent with a shotgun entrance wound. Okay, and we can see the dots around here. Those are from pieces of gunpowder that have basically impacted the skin because it's within a distance of 3 feet or so.
Moving now to states 480.
Okay, so usually when I take a photo, I don't want to go too close because then you won't be able to see where it is on the body. But here, this is recognized, this is the nipple, right? His left nipple. And we saw the entrance wound over here. And so here we have the, this is an exit wound where this pink wadding is basically stuck right there. And you can see these are the petals on the edge, and that's what gave that unique appearance to the entrance wound. Now, this is basically a cylinder that encloses lots of pellets. And then the pellets here, we start to actually have some of the pellets coming through the surrounding skin and then along the left side of the lateral side of the chest, kind of below the armpit.
All right, and I'm going to show you what's been marked as states 111, already in evidence at this time. Do you recognize that?
Yes, so that is the wadding that I recovered at autopsy and took a picture of it before I recovered it, so that's the wadding that was from Paul's chest.
And just again, point that where that is in that image, please.
Yeah, so here it is. It's kind of peeking out through this big hole in the left side of the chest.
All right, let me move on to the next exhibit. I'm going to put up on the screen now states 481. And tell me what this image
Okay, so this is a photograph of the same wadding, but I'm taking it from a different angle, okay? So he's lying on an autopsy table, and I've moved his arm up to show the relationship of this wadding with the entrance pellet wounds on the underside, the underside of the left arm. And interestingly enough, a lot of times pellets just go through the skin, but here we have some abrasions around the skin, and it actually corresponds to abrasions. We normally don't have abrasions with an exit wound, such as we have here, but the fact that we have abrasions on the underside of the the left side of the chest, corresponding to the inside of the arm, indicates that his arm was down at the time of this injury.
So let me ask you about that. In your expert opinion, having done 5,500 autopsies, is there any way that Paul's hands were up when he suffered that shotgun wound to the chest that you've been talking about?
No, the autopsy answers that question, that his arm was down by his side at the time he sustained this injury.
And again, highlight the specific features that you observed that caused you to come to that expert opinion.
So if, let's just say hypothetically, if his arm was up, you see all of these abrasions around this exit defect and the abrasions around these pellet entrances. We wouldn't see that because they, those are caused by when these pellets and the wadding is pressing up against the skin is very elastic. So this is just kind of logic. I think you're all going to get this. It's kind of going to push the skin before it actually exits. The skin's going to stretch a lot. And if it hits up against the other portion of the skin, we have kind of abrasions, which are kind of scrapes on the skin around where it exited as well as where it entered. So these are sometimes called it's a shored exit wound. So the skin actually struck another area, and in fact it corresponds exactly. It's like a reflection. We can see this is reflected. This one is reflected over here. So if we can only get that kind of a mark if his arm is down. Now this is the kind of thing that is the logical conclusion, and I'm confident that was the position of his arm at the time he was shot. And this is based on my training and more than 20 years of experience doing these cases.
All right, let me look at the next exhibit, which will be 482 for the record, and tell us what you see here, and also, if you could, Helen, also supports the conclusions you were just talking about to the jury.
Okay, so these are the exit pellet wounds on the outside of the arm in this area, right? So this is kind of like his armpit here. And we can see these are kind of just, these pellet exit wounds don't have the kind of abrasions around it. This is just kind of finding its way through the skin. And then this one is over here. So, and as the further the pellets travel, it kind of splays out. So after the pellets leave the wadding that is open, they're spread. So, but these are, exit pellet wounds, and we don't have the kind of abrasions to suggest that his arm was pressed up against anything at the time that those pellets exited.
All right. One other thing as well is when talking about his arm being down, of course, the wadding stopped in that wound still in his chest, correct?
Yes.
Okay. All right. Let's move on. Just give me 1 second here to get some other exhibits and show them to defense counsel. All right, Dr. Reimer, if I could get you maybe to stand that way just a little bit. I know we're in tight confines, and then we're trying to be as respectful as we can with these images. I'm going to show you now what's been marked as 483, states 484, states 485, 486, and 487. And just quickly tell me if you recognize those, and then I want to go back to the board before we talk about those pictures.
Yes, I recognize these.
All right, and those autopsy photographs that you took of Paul Murdaugh?
These are photographs that I took at the autopsy of Paul Murdaugh.
And would they assist you in explaining to the jury the injuries that he suffered?
Yes.
Your Honor, this time I'd move states 483, 484, 485, 486, and 487 into evidence.
No objection, Your Honor.
They are admitted.
And Your Honor, I think all these exhibits, both he and I, 90% of them we're introducing will be under seal.
Yes, sir. And for the record, these are under seal, and I provided the cover sheets to the court reporter. Every exhibit except for the poster board that we're doing, the state would request be under seal because of the graphic nature. All right, Dr. Reimer, that was, and we'll come back a little bit more to that first injury, but there was a second shotgun injury as well. Is that correct?
Correct.
All right, and I'm going to go back to states 500, which is the poster board. And if you could explain to and draw on this diagram that second injury, and then
Okay.
we'll look at the picture.
So there was a large shotgun wound defect to the top of his left shoulder. And there were lots of pellets recovered in the left shoulder area. And from there, it kind of just went across the top of the left shoulder and then went into the left side of the neck and face. Okay, and from there, his face actually was not destroyed from this, but there's a big exit wound on the top of the right side of the head. So this wound went from his left toward his right and upward, and with a slight front to back deviation. Now, what does that tell us? We don't really know. It's kind of going toward, it's sparing his face, it's going behind the face. Now, one thing that makes sense to me, how could that happen? If he was just standing, not everybody gets shot like standing like these diagrams, right? But if he was shot and his face was forward, it would have taken off a lot of his face. However, if he is turned toward the shooter, then it's going to go into the face here and go out toward the right back of the head. So to me, it makes sense that his head is turned to the left. Not necessarily completely, but partially turned to the left. And what happened here was an extremely severe, immediately fatal injury, because what it did was that after it went through the left side of the neck and face, our brain is basically held up through the skull. So we have bone at the top of the skull, but then we also have a bone that kind of holds up the brain. It went through the base of the skull, okay, which is kind of like in this area. The brain is up there. And this wound, actually, his brain was ejected out of the top of the right side of his head and actually arrived at the autopsy in a separate bucket. So the force of this wound actually pushed the brain out of his head. There was only just a small piece of brain remaining, and that's the brain stem that was attached to the spinal cord.
All right, and real quickly, going back to the first wound to the chest, if Paul was standing when he suffered that, could he have remained standing after suffering that wound?
Yes.
All right. The second wound, the one that starts in the shoulder and goes in here and then out the top of his head, what would have been the effect of that wound?
That would have been immediately fatal, and he would not have been standing. He would have just fallen to the ground.
All right, and would he have been capable at all of bracing his fall or anything like that with a catastrophic injury like that?
No, that's instantaneous death.
All right. Did you notice any abrasions on his face or anything like that?
Yes, he did have, and it's depicted in one of the photographs. He does have a kind of a scrape on his face, and very frequently scrapes on the face that it has a slight directionality. It's consistent with a terminal collapse. So if he's hitting the ground with some movement, there's frequently kind of a linear pattern. And, all of this really makes sense. Once you see these things, you can understand that if somebody is going to fall with, the force of their body, and they're going to hit their face on the ground, and we get some abrasions that correspond to that.
All right. And let me do this real quick. If you could grab that dowel stick for me, and I want to make sure the jurors down here had a chance to see what you've been drawing.
Okay.
So that's the shoulder right
Yeah.
there, and then...
Yeah, I should have made a red mark here to be consistent. This is the exit wound on the right side of the head. And the brain came out of that exit.
Now, you mentioned a little bit about being consistent with Paul kind of having his head tilted to one side. If you could use the dowel stick, maybe use me as an example and show me kind of what you're talking about. You can position me however you want to.
Yeah, okay.
Let's go out here a little
So
bit. Yeah.
to start with, like a different idea, okay, in order to understand how that's the case. So if a shotgun wound is entering the top of the left shoulder, and let's say his head is turned like that, it's going to go right through the face, right? But if his head is turned like that, it's going to spare the face and be able to go behind the face. So if somebody's just standing looking straight ahead, this most likely would have done a lot of damage to his face. But the fact that the face is remained intact tells me that his head was, I don't know, up or down, but his head was facing in the direction from where the shotgun was being fired.
And then the injury to the shoulder would have been where, if you just point to this?
Yes, so it's kind of on the top of the shoulder. This also did not injure his chest cavity. It kind of went through a lot of the skin and muscle and fat of the left shoulder. And there were a lot of pellets that were recovered from the left shoulder area as well as the head and neck.
And I'm going to show you very quickly what's been marked as states 110, and do you recognize this item already in evidence?
Yes, these are the pellets that I recovered from the left shoulder and head area.
All right. I'm going to go ahead, and if you could stay on that side so the jurors can see, and I'm going to...
This side?
Yeah, if you could work on this side so that the jurors down on that end can see, and I'm going to look at some of these. All right, and I'm going to show you first what's been marked as states 483. And can you tell me what's on this particular image, particularly as to some of the things you were just describing as to the abrasion and things like that?
Yes. So we can see this is basically an abrasion, is a fancy word for scrape. So there are scrapes on the right side of his face. And you can see they kind of have, you can kind of see that there's a little bit of linearity. So if he just fell completely flat, we might just get dots, but if there's some movement, we get, it's kind of, he's hitting the ground and then moving it a little bit as his face hits, so we get this kind of vertical direction. And this is a very typical type of injury to the face that somebody might suffer from a terminal collapse. So after they sustain the fatal injury, what are they going to do? They're going to fall to the ground. Now, depending on the surface of, if it's concrete or, grass, we might get some, but this is very typical of I don't know what kind of surface it was, but a terminal collapse.
Okay. All right, if you would, with this image, and this would be states 484, please explain to the jury using this image some of the concepts that you've been describing to them.
So this is the top of his left shoulder, and this is the continuation of the ammunition through the left side of the lower face, and from there it proceeded behind the face through the base of the skull and exited the right side of the top of the head and sort of toward the back of the right side of the top.
And those two sort of together, that's kind of what you described before when you had positioned my head in the manner in which you did.
Yeah, that's right. So my feet turn to the left like that. I think that makes the most logical sense, and forensic pathology is really logical. So when we look at these things, we have to think, how could this have happened? And, after it's not always immediately obvious, but, with some thought, we can come to these conclusions with confidence.
Turning now to states 485. So this is another perspective.
Yes, so this is the same injury. This is formed by a single piece of ammunition here that went through the top of the left shoulder. It tore it up, right, and then went into the left side of his face and neck. And some of these pellets also did a lot of damage in the neck because they kind of splay out as they go further. And some of them went actually through his airway and other structures of the neck, as well as continuing through the base of the skull and propelling the majority of the brain out the right side of the back of the head. Okay.
And now going to the sort of the end of that particular wound, tell us what this
Okay,
image
so,
represents.
you know, you can kind of see, it looks like this piece of his head, we're not really seeing the entire thing because his forehead is basically still intact, but you can appreciate at this point that, you know, the contours of his skull are disrupted. And that's because there's a defect at the top of the skull, but not involving the forehead, so it's kind of in the back. So we know it was going, it started at the shoulder, it's exiting in the back, so his head may have been like that. Facing toward the left.
Stage 486, and finally stage 487.
Okay, now this is, all right. So this is,
I can't. It's
Yes.
hard for me to see what I'm doing.
it's
but-
okay.
Yep.
Yeah, so this is actually a photograph of the right side of, this is his, the face area, okay? And I know that because I usually, when I take a photograph of the number, I usually have it like right side up, okay? So this is the top of his head, and this is,
Dr. Reimer, I apologize.
no,
Can you
yeah.
do it like that? That
Yeah,
might be
that's
a little
good,
better.
right. So now you can sort of see, this is the right side of his head, and it's horrible, I know. And there's a big defect there, and we can see the inside of the skull, but it, you know, his face was spared, so.
All right, Dr. Reimer, if you would. That's all the images I have right now.
Excuse me.
The jury room for a few moments. Please not discuss the case. You may bring the jury.
The jury is present, sir.
Thank you. You may proceed.
Your Honor, may I please record? Dr. Reimer, before we took a break, we were obviously discussing the very catastrophic injuries from that second shotgun wound to Paul, and that would have been immediately fatal. Is that correct?
Yes.
Let me ask you this very quickly. Do you see any evidence of any defensive wounds on Paul?
No, I did not.
Can you describe quickly what a defensive wound is, and then explain why you see none in this particular instance for this?
Yes, so a defensive wound is, you know, sometimes somebody might sustain injuries that suggest that they had their hands or arms up while trying to defend themselves from from what is about to happen. And I don't see anything on his hands that would indicate, you know, he had his hands up to his face in anticipation of the injury that was about to happen. So,
In your expert opinion, as you described it to the jury before, his arm was down for that first shot.
yes, so that first shot, his arm was down, and I don't see any evidence of injury to his hands from the second wound.
And then that abrasion on his face is consistent with that second shot and him just having terminal
Right,
collapse.
so falling to the ground, hitting the right side of his face on the ground with a little bit of forward movement, so we got that kind of linearity, and that would be consistent with collapsing to the ground after, it's very frequently people, you know, after sustaining any kinds of disabling injuries, if they're standing up, they're going to fall. It's just gravity. And so he fell, and he was face down at the time, so he had a scrape on the cheek, which is the surface of his body that impacted the ground.
What were toxicology results on Paul, if any?
Yes, so
Anything that he might have had in his system?
oh, yes. So every person that has an autopsy at MUSC, and everybody gets a full toxicology testing done. MUSC does not actually perform toxicology, but toxicology was sent to a toxicology lab that tests for any possible substances that may be in the blood, and the only thing he had in the blood at the time of his death was caffeine.
No alcohol or drugs?
No alcohol or drugs, was negative.
Were you able to reach any conclusion about the order in which Paul suffered these shotgun blasts?
Okay. Well, in my opinion, based on my education and experience, the first shotgun wound, the initial shot was to the chest, following which he remained standing and sustained the other gunshot wound to the top of the left shoulder and head. If we think about it, well, is it possible that the other one was first? It just kind of defies logic, right? So if he got that one first on the left shoulder and through his head, we know that one sent him to the ground. So he fell to the ground, hit the right side of the face. How is he possibly going to get that one to the front of the chest? So it's just hard to imagine a scenario in which the shotgun wound to the head was first.
Let's move now, if we can, to Maggie Murdaugh. And you did her autopsy as well as you described as jury, is that correct?
Yes, I did.
All right. And how many gunshot wounds, just very quickly, did you observe on Maggie?
So she sustained a total of 5 gunshot wounds from a minimum of 4 shots. So it could have been from 4 shots with 5 wounds or 5 separate shots. And I will explain once we do that.
I have what's been marked as States 501, and again, this is another diagram that would assist you in explaining the injuries.
Yes, so this is the female, the woman diagram, and and this is what I used to take notes while I performed the autopsy.
All right, if you would step down, please, and walk over here, and we'll do the same procedure with Maggie. You can start out by writing her name at the top, and then put the left and right on there too to aid us in understanding.
Okay.
All right, and let me do this just very quickly. I apologize. And going back to States 500, and this is Paul, is that correct?
Yes.
And you had an arrow right here kind of showing the direction of shot number 1, is
Yes.
that right? Can you do an arrow for shot number
Sure.
2, please? And Your Honor, this time I'd move States 500 into evidence for demonstrative purposes. So I'll move it into evidence.
Is he going to just use it for demonstrative purposes, or is he moving it into evidence?
I'm moving it into evidence.
No objection.
Let's admit it without objection.
All right, going back to 501, this would be Maggie, is that correct?
Yes.
All right, if you could start to detail the injuries that you observed to Maggie and what is the most probable order based on your review of
Okay.
the evidence.
Well, first of all, this was a different weapon. It was not a shotgun with wadding and pellets. These injuries that Maggie sustained were completely consistent with an assault rifle. So it's a different weapon. And I'm going to go through the 5 wounds, and then we'll think about how I'll try to explain my opinion as to the likely order, just sort of like we figured out Paul's shotgun wound to the chest came first, but we'll do the same with hers. But she's got a few more wounds, so it could be a little bit more, require a little bit more logical thinking. Okay, so she had an entrance wound that was right over there. Okay, it's kind of right below the rib cage, not far from the middle of her midline of her body. And that wound, okay, now we're going to remember, this is right and left. It's very easy to get the right-left situation confused, but that's going from front to back and downward, and there was an exit wound kind of like right down here. Okay, so it entered here. Okay, so we're in a kind of downward direction. It was actually 10 inches below where it entered, so it's pretty low. Down here was the exit wound, and on the way, that projectile, that bullet, went through the abdominal wall. That's like our muscle and all that. And then once it got inside the body, it went through mesentery, which is the supportive tissues of our intestines. So it went through mesentery, has all the blood vessels and lymphatics, all that stuff that supports our intestines. The intestines take up a lot of room in there. Now it's continuing to go toward the back of her body, went through the pancreas, okay, which is kind of toward the back. And then as it's traveling left, it went through the left kidney and left iliac artery, which is a blood vessel that leads off the aorta before exiting the left side of the back.
All right. And let's go ahead. Can we do the second wound, and then we'll talk about both of those together in a second, if we could.
So we've got two that are basically completely to the front of the body, directly to the front. And there's another wound that's kind of on the front inside of the left thigh, kind of like over there, okay? And this one is also going from front to back and toward the left and downward. So these two shots follow a parallel path. They're both, so this is the left, okay, left leg, right, left thigh, and the exit wound was in the back of the left thigh, and it actually, this is a little bit too high, okay, I should, but it was lower
Put
down.
an X through the wrong one.
I'm sorry.
Yep.
Okay.
All right.
Yeah, so it's traveling in a downward direction and also with a kind of a slight right to left. So I'm going to draw an arrow to indicate the direction, okay? So that one's going like that. And then this one is also going in the same direction, downward toward the back.
All right. And those, you said, followed kind of a parallel trajectory?
Yes, they had a relatively parallel trajectory. Another feature of each of these wounds is that, remember we talked about gunpowder stippling when somebody is shot at a relatively close range. Well, both of these wounds had gunpowder stippling around them, okay? All right.
And
Now,
go ahead and remind the jury what stippling indicates about probable distance from a firearm.
So within 3 feet. We don't usually see it any more than 3 feet. Sometimes it's within 2 feet, but depending on the firearm, I can't say exactly, but it's somewhere in that range.
It's a fairly close range of parallel trajectories for these two
Right.
wounds.
Okay.
Is that correct?
Yes.
All right.
And they both exited the left side of the body. One was on the, this is her left leg. It's really easy to get turned around here, okay? Left thigh, and the other's on the left side of the lower back. And the one to the left leg actually just went through. It went through muscle and soft tissue. It didn't actually break a bone.
All right. All right. If those two wounds, let's go ahead and do all the wounds. Can we go to the next wound that we have? And before we do that, was there a wound to the wrist in this particular instance?
Yes, there was a wound to the wrist, and it was on the left wrist. The entrance wound was somewhere around here. And, okay, so this is her left wrist, and then the exit wound was a little bit higher on the inside of the arm. So this is the kind of the hairy part, this part, and then the inside where there was an exit wound.
All right. And using my left hand, can you kind of point generally to the jury about the location of those?
Yeah, so kind of going in here and out there.
All right. All right. So that's 3 gunshot injuries at this point. Is that correct?
That's correct.
All right. Now tell me about the fourth one, if you would,
Okay.
please.
So the fourth one was somewhat unusual because it's going in an upward direction through the body. Okay, there was an entrance wound on the underside of the left breast that exited like the top of the left breast. Okay, and from there we have some marks on, there's like bruising on the left side of the chest up here, the left clavicle, and that bullet continued through the underside of the left side of the face. Okay, so there's a wound kind of like over there, okay, and everything is kind of going up. So this was an exit, and then we have like a re-entrance, okay? So we have a series of defects. This is an entrance, an exit, and then the bullet continued through the left side of the face and lower ear area and into her head. Okay, now in addition to that...
Just real quick, those first two wounds that you described, the wound to the abdomen and the wound to the leg, and those were both to the front of the body, is that correct?
Correct.
And they both had a similar parallel trajectory, is that correct?
Yes.
Would either one of those wounds have been immediately fatal?
No.
All right. The wound you just described, how about the wound to the wrist? Would that have been immediately fatal?
No.
What about the wound that you just described that went in near the breast and then went into the head?
Yes, that would have been immediately fatal because when it entered the left side of the face, it basically destroyed the brain.
And was there another gunshot injury, traumatic gunshot injury, aside from that one?
Yes, but I'm going to, before I continue, I did want to mention that there was an abrasion, kind of a scrape, below that, which indicates below her left breast. So it indicates before it actually went through the left breast, it kind of scraped along the abdomen as it was going upward before it went into her head.
On the injury, the gunshot wound, the assault rifle wound to the abdomen, and the assault rifle wound to the leg, you said there was stippling there. Is that correct?
Yes. The other wounds did not have any stippling,
Right,
so they were from further back.
The wrist wound had no stippling?
Correct.
And that wound that you just described going up into Maggie's head, that did not have any stippling either?
Correct.
All right. You mentioned there's one more as well to her head. Is that correct?
Yes.
All right. Describe that to the jury using this chart, please, or this diagram.
Okay. So there was an entrance wound to the back of the head, okay, that was kind of like right over there, okay, and it's kind of near the base of her skull, and that was going downward, okay. Now this is like automatic rifle, some like it's a rifle ammunition, so it's not a single, cylindrical projectile that remains intact. These rifles, the projectiles fragment as they go through the body. That's one of the mechanisms by which they do enormous damage. Okay. Now this wound was going in a downward direction, and then we have lots of exit wounds on the right side of her upper back where all of those fragmented projectiles, fragments, exited. And this wound, it's in a clearly downward direction. It entered the back of her head, went through the back of the skull, and through the brainstem and cerebellum. And so these are vital portions at the very bottom of the brain. But it did not enter into her chest. It continued just scraping along the top of the back. So we know this is going in a downward direction. So how do we reconcile? How do we make sense of a wound that's going upward and then another wound that's going downward? Okay, you'll recall this wound that went through her left breast and into the left side of her face injured her brain, right? She's not going to be standing anymore. Now, how would this even go upward? Okay, those first two shots, right? The one to her, or we'll say the one to her, it's the right side of her abdomen. That went, remember, through her pancreas and the left kidney. Kidney pain is usually very painful. We can imagine this did not immediately cause death, but she may have been bent over straight, and that puts her in a position, if someone's bending over, leaning over, to get a gunshot wound that goes along. So when we look at her body in an upright position, and she's got a gunshot wound going upward, we know it's going upward because it ended in her head. probably her body was bent over, and it may have been that she just sustained this very painful wound to her abdomen, not in addition to her thigh, and she was most likely, in my opinion, bent over or even possibly on the ground, but not completely lying flat, at the time, because then it would never have been able to go through the front, you have some like skip areas here. So if she's bent over, we have some skin folds, we're going to get a skip, plus it went through the underside of the left breast, exited the top of the left breast, so that would indicate that her breast may have been sort of, like hanging down a little bit.
All right, so do you have that dowel stick anywhere? Unless if you would, just, again, use me, if you could, just describe some of the concepts you're talking about. And let's start with those first two shots to the abdomen, and then just kind of position me as we move on to the shots.
All right, so one wound.
Let's stand over here if you would. So the
Absolutely.
jury can see.
Okay. Well, now I have to kind of, I'll have to, I can't show this. Yeah, going to show the entrance would be about there, right, top of the abdomen, and it went through the body, exiting on the left side of the lower back. Mm-hmm. And while it was in the body, went through the pancreas and the left kidney and a blood vessel nearby.
All right, and then the wound to the thigh.
Okay, the thigh was kind of on the front, but a little bit toward the inside area. And that exited lower down on the left thigh, in the back of the left thigh.
That one to the abdomen would that have been very painful?
Yes, I mean, if you ever knew anybody that had kidney stones are some of the worst pain in medicine. People who aren't getting kidneys will have to be on very high doses of morphine just to control the pain. Well, she had, like projectiles, ammunition going through her left kidney. We can imagine that was a very painful wound and may have caused her to, fold over in pain.
So something like this?
Yes.
And could it even been that she put to the ground and she's on her hands and knees, something like this?
Yes, that's also possible, and she could have had her head bent down or sort of touching the ground at that point as well.
This one right here, that you described right there, is there any way at that point in time she could have been completely thrown flat on the ground like this?
No, because then how, well, it's not just going to go up. So she has to at least have been, I can't say for sure, but it makes sense that after receiving those first two shots, she's going to be bent over at least, or possibly, even lower to the ground, enabling her to get a wound. Like that. That's perfect. Okay, going through the front of the left side of the chest, and if your head is bent over even further, you can imagine it's going to go into the head like that. Okay? So when I first look at this, I'm like, what? It takes a little, but in retrospect, now that I've made sense of this, it all comes together. So
far at this point in time, we've talked about the abdomen and the thigh wound. In your opinion, are those two shots the first two shots she suffered?
Yes, I think she was standing upright at the time, and then she only could have gotten the wound to the left side of, through the left side of the front into her head if she's horizontal but not completely on the ground. But after sustaining that wound, okay,
She could have been down on her hands and
she
knees
could have been
too.
down on her hands and knees or just bent over, right? It went into her brain. She's going to fall to the ground completely. And that puts her in a position to get the gunshot wound to the back of the head. I can't really, you might not, you're too far away for that.
Sorry, I'm gonna go over here, but show me that
Yeah,
last wound.
okay, so the last wound was going in a downward direction, entered here, and it's kind of, enough to fracture the skull and go through the back of the brain, it's like a brain stem, and then have just a bunch of exit wounds there. So that's, that actually is in kind of a downward direction. So we've got something going upward, we have something going downward, and it only makes sense that the one to the left side of the front occurred first, because if the one to the back of the head she basically was already had injury to the brain sufficient to have killed her. The one to the back of the head that went down was, an additional wound, but the one to the that entered the left side of the brain was already sufficient to have killed her.
If she had not suffered this one right here, the one where she's hunched over her hands and knees, if she had not suffered that one, would this one to the back of the head also been immediately fatal?
Yes, either one of them would have been immediately fatal. That one went through the brain stem and the cerebellum. Those sections of the brain, their whole job is to keep us alive. They keep us breathing, and so the cardiac rhythm, and without that, none of us would move.
But in your opinion, abdomen and thigh is first. This one that went through her breast into her head is after that, and then this one is when she's prone on the ground to the back of the head.
So I
It's the
do
last
think
one.
this isn't something that I immediately realized, but after thinking about it, how this gunshot wounds to one person, how do I make sense of this? And this is the most likely logical sequence of shots that she sustained. I also want to mention, remember we had this wound to the, so we have 4 we know about, right? We've got right side of the abdomen, left thigh, the left side of the head in the front. We have breast first, and then we have this last wound while she was prone on the ground, okay, to the back of the head. We also have this additional wound to the left wrist that exited a little bit higher. Now, is it possible that her arm was just somewhere and got shot? Yes. But remember, we know that she must have been in a lot of pain in her abdomen from that shot that went through the abdomen. And if she is bent over, where would her hand likely be? It makes sense she might be bent over with her hand right there. And so if her hand is bent, she's got her hand on her belly, the wound entering the left wrist could exit there before actually going up. So if she's got her hand on her belly, I don't know if that's actually happened, but that's why I described 5 individual gunshot wounds, but because the left wrist could have moved, it could have happened before another one.
And what you just described there with her wrist kind of close to her stomach after suffering that abdominal and thigh wound, that is consistent with the evidence what you just described. Is that correct? That having her hand right there, like
yeah, that it would be consistent. I can't say 100% that that's what happened, but that is a gunshot wound to the left wrist, and it may have been sustained while she had her hand on her abdomen.
Give me 1 second. All right, Dr. Reimer, I'm going to show you some images, and if you could stand back that way, just so we can again try to protect these as much as we can. These again are very rapid, is that correct?
Yes.
And I'm going to show you, if you could, and I'm going to kind of give them to you this way. States 488, 489, 490, 491, double check, 492, 493, 495, 498, and 499. And do you generally recognize those images?
Yes.
Autopsy photos you took of Maggie Murdaugh?
Yes, these are photographs that I took of Maggie Murdaugh's wounds.
All right. And would those assist you in explaining these injuries to the jury?
Yes.
All right. Your Honor, at this time, I'd move into evidence. States 488, 489, 490, 491, 492, 493, 495, 498, and 499.
Admitted.
Dr. Williams, if you could grab the dial stick and come on down here, and I'm going to try to move through these as expeditiously as I can. Starting with 488, tell the jury.
What? Okay, thanks. Okay, so,
You can stand on this side real quick.
yeah,
So that,
oh, got it. Okay, that's good. All right, so, this is a photo of, her left thigh. Okay, this is the knee area. And we can see this is kind of on the inside area, of the front of the left thigh. And we do have the stippling around it, which tells us that it was shot within a certain, like, relatively close range.
and we have the stippling as you've described. Moving on to
Okay.
stage 489. What is
All
this
right.
right here?
So you can kind of appreciate this is like the curve of her knees. This is the back of the left thigh where we have an exit wound.
Going on now to stage 490. What is this?
Okay, so this is the entrance wound on the right side of the front of the abdomen, below the rib cage, close to the midline. And we do have stippling here. It's a little sparser and a little further spread. So that was also close enough, within 3 or so feet, to deposit the stippling, probably a little further back than the one to the left thigh, because there's more tightness of the stippling on the thigh. So if we think of it as kind of going outward, it covers a wider area and is more sparse on the right side of the abdomen.
Moving on to the next one. What is this right here?
Okay, so this is the exit wound to the left side of the lower back.
Just very quickly, you mentioned that there's stippling on both the abdomen and the thigh, but there's a little bit of difference in distance between the two. Is that correct?
Yes, a small amount. There's stippling on both, but the wound to the thigh is a more tighter, more closely packed bunch of stippling, and doesn't appear as further away from the actual defect. So that is a little bit closer than to the barrel of the gun was a little closer to her body than the one to the right side of the abdomen, but both of them were within 3 feet.
And those were the only two wounds that you observed with stippling of the ones that you've described. Is that
Yes.
right? All right. Going on now to this next 492. Tell us what this is, if you would, please.
Okay, so this is a wound to the left wrist, and we can see this is her left thumb, so it's kind of right over there. It's going through the left wrist, exiting on the soft side of her left forearm.
And moving on now to 493. What does that look like?
Yes, so there it is. That's the exit wound. So she had the entrance wound to the part of her wrist near her thumb, and it's going through the left forearm area, exiting at an angle. Right? We know it's kind of exiting at an angle because this defect is oblong. Right? If it's going straight across, we would just have a hole, right? But if something's exiting in an angle, we have more of an oblong exit.
All right. Moving on to the next one, and again, this is graphic, but can you
sorry.
tell me what this is, and I'm going to move the picture down as you describe it, please.
Okay, so here's her belly button, just to give you a reference point. And this was that entrance wound on the right side of the abdomen. This is another injury that kind of grazed, kind of abraded the left side of the abdomen before going through her left breast.
And then moving down.
Yeah.
Was that
Okay.
sufficient? I can't really see.
Yeah, so it's fine. Okay, this is a very large destructive hole in the left side of her face, including parts of her left ear, and this makes sense to be a continuation of the one through the left breast. I was confident that this was all the result of a single bullet, single fired shot. And what we see over here is basically a bruise from, it didn't actually go into the left shoulder, but as it's coursing upward through the breast before it kind of go, and if she's bent over, then it's going to bruise this clavicle area, right? That's that bone right here, before going into the left side of her lower face.
All right, moving on. Now, and I'm going to go out of order just a bit. I'm at 499, and can you explain?
All right, I'm having trouble seeing what this, oh yeah, okay, yeah, so at the time I did the autopsy, and I have a wound to the left wrist and through the forearm, and a wound that's going along the left side of the abdomen. I can't be certain, I can't say with an absolute certainty that her hand was up against her abdomen at the time that the gunshot wound to her torso was going upward. But if her hand was on her abdomen, which she may have had there after getting shot through the abdomen and bending over, this would be a perfect line through the, through the wrist, throughout the left forearm, and like continuing in an upward direction for fatally entering the left side of her head.
Is that an explanation for how the wrist and that gunshot could be related?
So I took a photo of the wrist and the scrape along the left side of her abdomen together because it occurred to me, based on my experience over decades, that this may have represented a single inflicted shot. Maybe the one to the wrist was a separate shot. And in my autopsy report, I described it as separate because unless I'm absolutely certain that it's from the same shot, I'm going to describe them separate. But I'm able to tell you, so we have 4 wounds to the body, and it may, 5 wounds, but if we count the left wrist as separate, but if the left wrist was connected to the other one, to one of the others, then it's there's only 4 shots to the body.
And then finally, states 498.
Okay, so this is also a very ugly shot. This is the back of her head, and is a routine matter. She had hair there, but it wasn't apparent what kind of a wound she had back there. There was blood, but I'll cut away the hair to display the entrance wound. And you can see how long it is. It's long. It's not just a hole going from back to front. It's going in a downward direction like that. And this ammunition breaks up into fragments, and we have like these fragments basically coursing along the top of her back, going through the skin and the fatty tissue beneath in her upper back. So, and this one, before it actually hit the back, it went through the skull at the back, right side of the back of her head, as well as the brain stem and cerebellum.
Thank you, Dr. Reimer. We're almost done. If you could have a seat real quick, and we will conclude the examination. Your Honor, also at this time, I would move in to evidence states 501, which is the diagram that Dr. Reimer did of the injuries to Maggie.
Defense.
No objection.
They are admitted.
Dr. Reimer, you mentioned that there was a slight difference or a difference in the stippling between the abdominal and the thigh wound, and which one seemed to be a little bit farther away according to your review of the evidence?
Yes, the gunshot wound to the abdomen was slightly further away than the gunshot wound to the left thigh.
And that could be consistent with Maggie and the shooter changing their positions in relationship to one another.
Yeah, people aren't completely just standing still. It could be that the shooter was moving closer toward her or moving a little bit back or she could have been moving, or a combination of the two. So I don't know what happened there, but I do know that the barrel of the gun was closer at the time it struck her left thigh, because the stippling is more tight concentrically and doesn't cover as wide an area as the one to the right side of the abdomen.
You've described the injuries to the front, and then the injury to the breast and to the head, and then this final injury to the back of the head. Could that be consistent with the shooter circling his victim?
Yeah, I think that only makes sense if there's some movement on the part of the shooter. We know the gunshot wound to the front of the body that's going up. If Maggie was bent over, either in air or on the ground, the shot would have been fired from behind her, right? From behind her, that's the only way it's going to go up and through the base of the chin area into her head, right? She's bent over. That's the way that it logically makes sense. Nobody's sitting on the floor, and you couldn't do that. And after that shot was sustained, the one that went through the front side, the vertical one, okay, it's vertical through her body, but most likely occurred while she was bent over, or then that's going to be an incapacitating shot because it went through her brain and caused her to fall to the ground. She's bent over, she gets that shot, she's going to fall face down, and then the last shot to the back of her head is going in the other direction. So that's going downward. So we have one going, so that only can occur if the wound to the left side of the front is somebody shooting from behind her, and then the gunshot wound to the back of the head is going downward while she's on the ground, indicating somebody's standing at at the top of her.
Was there a lot of blood accumulated in Maggie's abdomen?
Not that much. The thing about these wounds is there's so much tissue destruction that blood is just basically in all the tissues. So it's not like sometimes with even a small caliber bullet, there's a single clearly defined wound path, and I can take out blood from the abdomen. But in this case, there was so much tissue destruction. There was a lot of blood in the soft tissues, but not necessarily something I can scoop out and measure.
Did the lack of a lot of blood in the abdomen tell you anything about how rapidly these all occurred together?
Yeah, so if the wound stopped there to the abdomen and somebody walked away, she would have had more bleeding out of those tissues into the abdominal cavity.
In both Maggie and Paul, did you make any observations about their stomach contents?
Yes, so part of the autopsy, I'm not just looking at the wounds, I'm examining all of the internal organs, and this is how I knew it went through the pancreas and the kidney, because remember, I'm not just looking outside of the body. I have to do everything, look at all of the internal organs and dissect each one. And when examining the stomach, I will document the contents of the stomach, and they each had a lot of recently digested food fragments. So, they had a full stomach of food.
Were those stomach contents consistent with one another?
Yeah, they looked identical to each other. They were kind of gray tan, couldn't tell exactly what it was, but it may have included meat. I didn't see any corn or, green beans or anything like that. But whatever it was, they were identical to each other. And I believe she had 600 mLs, which is it's 450 mLs is a pound, so it's like almost 1.5 pounds of food, and he had 500 mLs, which is a little bit more than a pound. But they looked similar, like they may have shared a meal together.
You testified that there was no defensive wounds on Paul. Did you observe any defensive wounds on Maggie?
No, nothing that would indicate any kind of a defensive wound.
Did you observe any damage to her fingernails or anything that indicated that she had been in a fight with her attacker?
No. That's also part of the autopsy. I'm, in addition to collecting clippings from the fingernails, I look carefully to see sometimes there's a fingernail broken, sometimes there's obvious tissue or blood underneath fingernails, and she didn't have any evidence of, material visually evident underneath her fingernails.
What about her toxicology? Did she have anything in her system? Any drugs or alcohol?
She had caffeine only, the same as Paul, and no other alcohol. No alcohol or other drugs other than caffeine.
Dr. Reimer, in your professional expert opinion, what was the cause of death to a reasonable degree of medical certainty for Paul Murdaugh?
For Paul Murdaugh, shotgun wounds. Let me see what exactly I said. I said shotgun wounds to head and chest. Shotgun wounds of head and chest.
And what was the manner of death?
Manner of death is homicide, which means death at the hands of another.
And Dr. Reimer, in your expert opinion, what was, to a reasonable degree of medical certainty, the cause of death for Maggie Murdaugh?
Maggie Murdaugh died of multiple gunshot wounds.
And what was the manner of death?
Manner of death is homicide, death at the hands of another.
Death at the hands of another. One final question. Did you recover any fragments from Maggie Murdaugh during your autopsy?
Yes. So this kind of ammunition breaks up into fragments. That's the nature of that ammunition, and so I recovered multiple fragments of projectiles.
I'm going to show you what's been admitted into evidence as Stakes 112, and do you recognize that?
Yes. So those are fragments I've recovered from Maggie's autopsy.
Thank you, Dr. Reimer. Nothing further, Your Honor.
Cross-examination.
I'm going to have an extensive cross-examination. You want to begin that tonight or first thing in the morning?
You want to begin it in the morning?
I think so. I mean, it's 5:45. It could go easily to 7, and I don't think the jury would, at this point, like to stay here. I don't, but.
All right. Ladies and gentlemen, we will recess for the evening and start at 9:30 tomorrow morning. Please do not discuss the case. Doctor, you may step down. Please do not discuss your testimony with anyone. If everyone will be seated. As we anticipate other witnesses tomorrow, are there any matters that the court needs to consider overnight regarding any matters of controversy or in controversy or outstanding issues regarding any witness?
We know, Your Honor. Not on part of the defense.
Not on part of the state. The new information from GM we addressed this morning, and obviously the defense has that, and both sides are analyzing that, but I'm not, aside from that right now, I'm not aware of any specific issues the court needs to address.
The only query I will have, because we're again trying to arrange for people to fly in, and Monday is not going to be a court day, is does the Attorney General have any prognostication on when he might finish his case? I think with the GM material it will affect it somewhat. I just don't know how much.
Your Honor, we're still on target for Wednesday. That GM material is just confirmatory of the timeline that both sides have had, and it's being incorporated into testimony. We have a custodian coming, which I don't imagine would be an extensive witness. We're still on target for Wednesday, Your Honor.
Okay, we'll be in recess to 9:30.
All right.
All right, good morning. We can have our witness back, Doctor. They bring the jury. All right, thank you. Good morning. Day number 17. Cross-examination.
Please, Court, Your Honor.
Yes.
Good morning, Dr. Reimer.
Good morning.
Let me at the outset say we're going to be just yesterday, as we went through direct, we saw some very graphic images, and I apologize, but we're going to have to do that again today. You, of course, this is what you see every day, but I'm sure you understand how other people may, especially people related to the deceased, might react to that.
Of course.
Now, let me also explain at the outset, until I read your autopsy report, I had never really considered the mechanics of a shotgun or an AR-15 or blackout impact on a human body. So I'm learning even as we speak, and I hope I can learn some things today that help me understand your opinions, and also help me understand what may have happened or didn't happen, okay? So if I ask you questions that seem simplistic, my understanding of this process is somewhat basic. So I'm going to try to walk through this in a way I can glean what the evidence is and what your conclusions are, okay?
Absolutely.
So tolerate my somewhat sophomoric approach to this, if you would, okay?
Of course. And I'm sure you'll be fine.
So let me understand, first of all, let's talk about Maggie for just a minute. And were you shown photographs of the back of her thigh that were taken at the scene? The
No.
back of her calf, I'm sorry.
I did not.
Okay. So let me see if I can find these. It'll take me just a second. I thought I had them laying right out here. Thank you for its indulgence. One moment. I apologize. I thought I had everything sitting right here. Apparently
If there's an item in evidence, you don't have to show it to opposing counsel to continue with the witness.
this is not in evidence. I apologize. Your Honor, I would offer into evidence Defendant's Exhibit 115.
Any objection?
No objection on the state, Your Honor.
And could I get that, please, on the screen? Have you seen that photograph?
No, I've not.
Okay. I noticed in your autopsy report, you remarked that there is a bruise on the back of the leg in that similar position, correct?
Oh, I don't recall.
Could you look, please? Thank you.
I don't see in my report where I remarked of a bruise on the left leg.
Okay, so was there a bruise on the right leg?
I don't have any. I didn't make any comment about that in my
So
report.
no one asked you to opine about any issue on the back of her left calf?
No, and I did not observe that at autopsy.
And by the time it got to autopsy, had her body been washed or?
No,
Okay, but if this is mud, you wouldn't necessarily expect to see
it
it.
could have fallen off. Correct.
So, you're not asked to opine about whether this was whether there was bruising on the back of the left calf, which would have been consistent with somebody stepping on her calf.
No, I was not asked about that.
Okay. And you were not shown this photo?
Correct.
Okay. And just to deal with Maggie a little bit further, you testified yesterday that the shots were consistent, I think, with someone circling her.
Well, I didn't actually use that term. I said that she was shot from at one point from behind her and at one point from above her. So that could mean that it could mean that she was turning before she got the first one and then fell, because she could have also been moving.
So we know that the shooter was moving because some wounds have stippling, stippling and soot. Am I saying that correctly?
Well, there was no soot, but
What does soot indicate?
Soot is a contact wound.
Okay.
So she had stippling, which is not quite contact, it's further back.
3 to 4 feet?
Well, usually, we don't see it more than 3 feet away. So it's somewhere within 3 feet.
Okay. And so she may have been turning. The shooter may have been moving straight on. I mean, that's as good an explanation for what you saw as somebody circling her, correct?
Yes, I mean, from my perspective, based on the autopsy, that is a reasonable explanation, of course.
So the reasonable explanation is she's moving, trying to perhaps avoid being shot, turning around, trying to run, whatever, right?
Well, she could be turning around after getting the initial shots.
Right.
And then if the shooter was still stationary, then she could have gotten that one. So it doesn't imply that she could have been moving, not just the shooter.
Okay. And the ones without stippling were the barrel of the gun would have been more than 4 feet away from her.
Well, it's kind of a rough estimate, but I would say, it would be more than 3 feet, possibly more than that.
And that would be the barrel, the end of the barrel of the gun.
That's right, because that's where the gunpowder starts coming out.
That doesn't mean the shooter was 3 feet away.
Absolutely not, just the barrel of the gun.
Right. And you testified about why there was a wound that would appear to be parallel to her, and your indication is that the shot that would have hit her kidney or pancreas or whatever, she might have been bent over.
No. The injury to the pancreas and kidney was on the right side of the abdomen,
Right.
and that went from front to back and exited the left back. The one that was kind of along parallel to her body was on the left side of the body going up.
So why did you testify that one of the shots would have been so painful she would have bent over? What was that consistent?
Yeah, that was the one to the right side of the abdomen, and the reason I believe it's probable or quite likely that would have caused her to bend over is because a subsequent shot was going sort of upward in the body, and it's hard to imagine that wound going upward and then into the head unless she was bent over. So it's a possible explanation of how she was in a position to actually get that gunshot.
So she bent over and it would go upwards. Why?
Because if somebody is standing behind her, and there's no close range here, but at least a few feet away.
So she got shot, then turns around, bends over, and then you're saying...
She could have turned around or not turned around, or I don't know if she turned around or the shooter's moving.
Okay. Did anybody ask you to look at the pattern of ejected shells from the blackout?
I wasn't asked to look at those.
Okay. So your conjecture, opinion, is based on purely the wounds and trying to figure out how that happened.
Yes, so I basically, I do the autopsy, I have everything to do with the body, and at the time, I never heard anything about, I composed my autopsy reports without any reference to the scene.
Okay. So let me move along to Paul for the moment, okay? And you indicate that the first shot would have been buckshot to the chest.
I believe that was most likely the first shot.
Well, because the second shot is basically executes in his
He would have fallen to the ground.
Right. And clearly he was upright when that first shot was made.
Yes.
Okay, and it goes in his chest, and would he have to be turned diagonally to the shooter for it to come out his left armpit?
No, not necessarily.
Well, if he shot straight on with
Yeah.
that buckshot, and if that was a
Yeah.
contact wound or
No, it's a close range.
close range, closer than 3 feet.
Yes.
Okay, can't estimate how far.
I can't, you'd have to test fire.
Okay, so the chest shot is if it's straight on, wouldn't it just go right through his lungs and his heart? And kill him?
Yes.
Okay.
So this was shot at an angle across, so that might indicate that his body was positioned perpendicular to the shooter. Now, the shooter could also shoot from the side, doesn't necessarily shoot from the front, so we can't be 100% sure
So
about these things.
if you're the shooter and
Yes.
I'm Paul, and you shoot me with that buckshot, if I'm faced to the side, would the results be consistent with your autopsy examination?
Yes.
Okay, and we know that some of those pellets, you think his arm was down by his side.
I feel confident about that.
Okay, and the reason for that is there are pellet holes in his arm, right?
No, that's not the reason. The reason is because there's bruising around the exit wounds. They're kind of shored exits, and then we have corresponding bruising on the underside of the arm. So it indicates that they were in close proximity at the time the pellets exited and then re-entered. Because if there was a distance, we wouldn't have the bruising around those wounds.
Okay, and do the pellets go through his arm?
Yeah, there were pellets that exited through the arm.
And so there's little pellet holes
Correct.
on his arm exiting.
Yes.
Did you see a corresponding entrance wound with the pellets?
Yes, the entrance pellet wounds were on the inside of the arm.
Right, and then they go out, and I think they struck things after that, as far as you know.
I don't know what happened to them after they left the body.
So either the shooter is to his right,
Yes,
shooting across,
yes,
okay, and you think that shooter would have been closer than 3 feet, but you can't say how
right,
close.
right. He could have been to his right, or Paul may have turned his body in that perpendicular manner yes.
But either way, there would have been almost immediate bleeding. Well, not a fatal wound. There would have been immediate bleeding from that wound, correct?
There would have been bleeding. It's hard to say how much, but certainly I would expect some bleeding.
But if there were footprints found halfway into that feed room, and those are Paul's footprints, would that indicate to you that he had stepped in his own blood?
Oh, that's certainly possible.
Okay, not inconsistent with what you have.
Correct.
And that second shot would have come, I mean, as I understand it, Mr. Barber, can you take your coat off and come here, please? I hate to do this to him, but I can't really do it to myself. So, if you would step down here, with permission, Your Honor, make you step down. Okay. And what I'd like to have you do is we need to not block these folks over here. Let's see how we do this. Or that gentleman right
You
there.
want me to stand back here?
That would be good. And he's fine. They're fine. Well, unless I get in their way. Let me see if I can avoid not falling over. Okay, so we've already talked about this wound. Left side. Okay. This wound, which goes in right about here. Show the jury where the wound went in.
Yeah, it was like between the sternum and the left hip, so kind of right over there.
Right over there. And Mr. Barber's a little bit taller. He was, I think, 5.
Yeah, I measured his height. I don't recall.
We'll talk about that in a minute, but I believe Mr. Barber's a little bit taller than he was. But I think we need to know that because I'm going to ask you to sort of chart things out. So the entrance wound is here and is consistent with him being, how about Mr. Barber, turn just a little bit that way. So the shot would have gone like this.
Yes, that's approximately correct, and it has a slightly front to back.
Slightly front to back.
Right,
about
but
like
mostly it's right to left. His
Okay.
right to left.
How about raise your left arm for me, please? So, and his arm was not raised, but I want to point out, it comes out, we're going to see some pictures in a minute. Okay, turn it a little bit this way. So it would have come out right under his arm,
Yes, we do have the exit pellet wounds there.
and we also have wadding, do we not?
Yeah, we have wadding stuck in the underside of his left
Okay.
arm.
And then it goes through his arm,
Yes.
still coming front to back.
Well, it's left to right, but there is a slight front to back because we have some exit wounds on the back.
Okay, so if I told you this is a narrow room,
Okay.
have you seen any crime scene photos
From here? No.
from
Oh, yeah, from this case, crime scene photos in my career, yes.
in this case?
I really didn't, I may have been shown a very small photo, like a couple of weeks ahead of trial, but I didn't form any opinions based on
If I
that.
told you that small room, the gap between some stacks of dog food here and the wall and the little thing over here is maybe 3 to 4 feet, and this buckshot goes through the back window on this very narrow, very small. So that would be consistent with what you're saying. Some of the buckshot comes through, and that was buckshot that you shot with in the chest.
Yeah, it was shot, we don't remember the exact size. Buckshot is usually bigger, but yeah.
Okay, assume I'm not
Yeah.
misleading you, okay?
Right, some shot.
Buckshot
pellets.
goes through and hits the back window.
Uh-huh.
That leaves holes in the window and hits in the door, the window frame, and goes out. One of them embeds in a tree back behind. So that is consistent with your findings, correct?
Yes.
That first shot. I'm sort of intrigued. Is there anything about the exterior of this shot? What's beveling? You know what a bevel is, beveling?
Yes, of course. Beveling is a pattern of defect through a bone. So when there's a gunshot wound that, for instance, goes through, let's say we could get an entrance wound over here and an exit wound over here. We're talking about handgun wounds generally. The way when there's basically a hole in one side of the skull, I can tell which is an entrance and which is an exit, even without looking at the skin. Okay, so for instance, if I get skeletonized remains with a hole through the head, I can see which is the entrance and which is the exit because the bone bevels in a characteristic way depending on the direction of the bone.
What is a bevel?
Yeah, bevel is like an angled chipping away of a hard surface.
So if a bullet goes through, and I guess the head is all bone, right?
Well, it's like a solid bone, right?
Right. So you can tell this is the entrance because is it like?
It's the entrance, on the outer table of the skull, it's a smaller hole. On the inner table of the skull, it's a bigger hole. So the bone is beveling outward as the bullet goes in.
So it would bevel in on the entrance and bevel out on the exit.
Yeah, well, bevel in, meaning sometimes people don't always use these words consistently, even forensic pathologists. But there is a inward beveling, but means it's kind of beveled outward. So
Bevel
the
outward,
ends-
inside the wound, you see something that would indicate
wider, yes,
Wider.
it's wider on the inner table of the skull than the outer table.
And when it exits, do you have a narrower bevel, if you will, or defect on the inside than on the outside?
Yes.
That was a lot. Okay. So, was there, since this didn't enter bone, is there beveling with the flesh?
No, it doesn't bevel because there's too much elasticity, and so just shredding. Frequently can't see beveling on long bones either. The skull is kind of a flat bone, so it has that characteristic.
Okay, and the second shot, as I understand it, you indicate, is, can you, well, first of all, assume that he is, so maybe we just forget about the feeding for just a minute, okay? So show the jury, please, where the initial, there's a shot, it's shot with a shotgun,
Yes.
and it is more than, since there's no stippling or soot or anything that would indicate a close shot, correct?
Correct.
So more than 3 or 4 feet away.
More than 3, yes.
More than 3. And where is the initial shot? Where does it hit him?
On the top of the left shoulder,
When you say the top,
the apex.
okay, are there pellets in here?
Yes.
In the apex?
Yes.
And I'm going to show you an X-ray in just a minute and have you demonstrate on Mr. Barber where that hit. And there's shot in here.
Yes.
And you indicated you thought his chin was bent to the
Yeah,
left.
this is something that I believe not necessarily have to be bent, but I do think it was at least tilted in this direction. The reason being, if this is in a horizontal direction and then goes through his cheek, let's say he's just your head up. And let's say it's just going through here, and it would just kind of hit like over this side of his head, okay? But meanwhile, it's kind of over here. So, and then the exit wound is back there. So at least we have a little bit of directionality like this. I don't know, if he was completely turned to the left, it would have gone through his face. But I think it makes the most sense knowing that a wound travels in a straight line, basically. Of course, these are pellets, so there's going to be a lot of destruction. But the fact that his face was spared from damage indicates to me that he had his head somewhat turned, I don't know exactly how much, but that it kind of coursed the top of the left shoulder into this left, neck, cheek area, and then exited the back of the head on the top.
Let me find the X-ray pictures while he's standing up there. Here we go. Wait 1 second. Excuse me, Dr. Reimer. I'm going to show you where you're standing right there, these pictures, and see if you can identify them. And if so, we'll put them in evidence, and then I'll put them up on the screen. So I'd like you to look at these 3 photos and tell me if you can identify these. Am I speaking loud enough for the report? Am I speaking loud enough when I'm facing that way? Okay.
Yes, these are X-rays that were taken at the commencement of the argument.
Okay. Your Honor, I would offer defendant's exhibits 111, 112, and 113.
No objection, Your Honor.
They're admitted.
So could I have, please, step over to Okay, I'm sorry. Oh, that's much better. Okay, so let's see. Okay, let's see 113, please. Okay, so this is his left arm, correct?
Yes.
And this material up here, we see these little dots. What is that?
Yeah, those are the shotgun pellets.
Okay. And they are, yeah, that's perfect. And so we see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, along that line, 20, along these would be pellets that would be along here, correct?
Yes.
And they begin at, is this his shoulder? I mean, the shoulder bone?
Yes, it's no, the soft tissue of the shoulder. The soft tissue of the shoulder.
Okay, I'll give you the
Yeah,
point. You
okay.
know what you're doing.
Yeah, this is the humeral head.
which would be-
Humeral head, which
should
is
show on Mr. Barber where that
Yeah,
is.
this is the bone of the humerus. So a humerus is that long bone from the shoulder joint to the elbow joint, and we can see that this is basically, it's not really perforating the bone. There may be some defect at the edge of the bone, but it's pretty much on top in the soft tissues.
Okay, and it goes on for a ways, and then if you would show me exhibit number 112. Okay, and would you focus on the upper right-hand corner, please? Here you go. Now, that corresponds to this large picture, that orientation.
Yes.
Okay, so what is this showing us?
There are significant numbers of pellets also in like the left neck area.
Show us on Mr. Barber where that would be.
Yeah, so the entrance is here, and pellets are basically spreading, so they're not, they're included, there are pellets in the left side of the neck area over here, and then there's also some going into the brain.
Okay, and let me see if I can count those. So, I mean, are these part of what we looked at before?
Yes.
Okay, and how far down did the new one start?
It's a different view, so may not include all of them.
Okay, so, but a number of them.
Yeah, I mean, the purpose of the X-rays is basically to show what kind of ammunition remains in the body, if any.
Did you remove these pellets?
Not every single one, a representative numbers.
Okay, so there's an exhibit that was shown to you by Mr. Waters of some pellets that you
Yes.
recovered, but that's not all the pellets you recovered.
That's all the pellets I recovered. I don't stay for days to recover each pellet. It's actually a lot harder than it looks. Here they look like you know exactly where they are, but you can fish for like an hour to find one pellet. It's fairly small and there's a lot of tissue, and
So
I get a handful of them, and that's sufficient.
Did you keep the buckshot separate from the birdshot? Because this is birdshot.
I don't think any of it was actually buckshot. Buckshot is very large, so they were all. I believe they were all collected together.
Okay, so you thought they were all birdshot?
No, I didn't make that conclusion. There's some kind of shot. I didn't make a determination.
So you didn't determine the...
Yeah, that's really the firearms. I'm the pathologist. It's the firearms expert to determine what kind of shot it is.
So,
I said shotgun pellets, and that's
right, so
sufficient.
if previous expert testimony was that the chest was a buckshot and the head was duck shot or some sort of bird shot, you're not going to disagree with that?
I really didn't. It all looked similar to me.
Okay. Now, let me see Exhibit 111, please. And can you, I guess the lower left, well, maybe not. Let's start with the lower left of this his left, lower right there, okay?
Yeah.
This is the total picture.
Okay.
And so what does this represent?
Yeah, we can see his upper and lower teeth here, the upper teeth, the lower teeth, and so he actually did not have any fractures of his teeth. So the projectiles were going behind the teeth. His teeth were not all fractured out.
So would you show on Mr. Barber where these pellets would have been?
Yeah, this is just a two-dimensional image. So they're anywhere between, like, here and here.
Okay.
It's hard to say based on a two-dimensional.
Okay, and I think, show us where you think the exit wound was.
On the right side of the top,
back of his head.
The top of his head,
The top of his head.
toward the back.
Towards
Yes.
that. And if you were to extend out the shoulder wound, the neck, the path of these pellets, and then the exit wound, I mean, did you actually see an exit wound? Was there?
Yes, it was blown out exit wound of the skull, and that is how the brain left the skull.
Well, actually, the skull exploded, basically, correct?
Well, the skull, and there was a defect there. I could not reapproximate the skull, so there's a piece of skull missing.
Was there a bevel around that piece of skull?
We don't get beveling when there's shattering of the bone.
We'll pursue that a little bit later.
It's not a typical feature. You could potentially see something that you can say, well, this looks like a little beveling. But in my experience, that's very difficult to assess because there's so much damage and fragmentation of the bone.
Take that pointer, please, using Mr. Barber as a mannequin, and show us the path of that shotgun blast.
So it was going along here and into the left side, I believe, makes most sense like this, and out the top of the right side of the head.
So if you, and that was, you say, at least 3 feet away.
Yes.
Okay. Let me have that pointer again, please. And if you would step right over there. And just turn a little bit this way for me. Okay. So your testimony is, and correct me if you need to step over here and correct the angle.
No, I don't like that.
Okay, well, show me what you like.
I like this straight,
Right?
and then because this is basically not, it doesn't look like it's going upward. It's going straight and then entering around there. So we have two distinct defects, a defect here and a defect there. So I believe the head was at least angled a little bit like that in order for the corresponding continuation of that defect to go in there. But I don't think it's going upward. I think looking at the left shoulder, it looks like it's kind of and if it was going upward, we wouldn't have as much in the neck as we do. So I think it's more like straight on.
Well, that would still be coming upward at some angle, right?
No, I think it's more straight. I really,
Well, how does it come out the top of his head?
Well, that's because if his head is like bent like that,
Right.
then it's going to go in that direction. Yes.
If it's straight, it's going to go here and then out the top of his head?
Well, it absolutely could. The thing about the neck, heads can be twist and turn, so it's not at all inconsistent with that. It's most reliable that we can look at the shoulder wound and see that it's kind of, it's very difficult to assess the angle from where you're standing, and that's only because the head can bend and twist. And so we can only know where it entered and where it exited, and it's possible the head could have been twisted or turned to correspond.
Would it be more consistent if he turned your head the other way, Mr. Barber, like that, to get it out the top of the head?
That could be. However, we have a defect over here. So how would that happen?
Pull your head back and keep it over in that direction. In other words, adjust him. Back and then over that way.
Yeah.
Is that consistent
Okay.
with it coming in here, going this way, and then out the
Yes,
top of the
I
head?
think that the head tilt to the right, as you've just demonstrated,
Right.
is perfectly consistent with that. However, because the hole here is here, I think even if his head's to the right, it would still be turned like that. Okay, now that makes sense to me.
So,
Right.
so the shooter would be at least 3 feet away from that right there, right?
Yes.
And would he have it up or would he have it down? Or
It's hard to say, and that's because the head can tilt. We only have one area of an entrance wound here, and it seems to be approximately horizontal. But it's impossible for me to say whether it's the entrance is kind of below him or at his level, or potentially above him with falling over. It's hard to know, and that's because people aren't necessarily standing up straight. And then also, the thing about injuries on the head and neck, there's so much twisting and bending possible.
Okay, Ms. Barber, stand up straight. You have the prick there? Okay, I'm sorry. So, now what you tell us is basically from here back on his skull, they can see. Why don't you stand over there for just a second so you don't block him? From here back on his skull, and I've looked at your autopsy pictures, all this is gone.
To the right side.
To the
Yeah,
right
and
side.
there were fractures on the left.
Okay.
So we know it's going in a left-right direction.
Do you have a seat for a moment, please? Thank you. I may be done with you, but don't put your coat back on. Okay, if you go ahead and take the stand again, please. Okay, let me ask you a couple preparatory questions. Are you familiar with this book?
Yes.
Okay, and it is like a definitive, I mean, I'm told most pathologists have read this and
Yeah, it's a highly respected book on gunshot wounds.
okay. So, if you go to can you identify this as page 228 in this book? Those images?
Yes,
Oh,
228.
showing, say, a copy of page 228. Defendant's Exhibit 116. Is this a copy of what I just showed you out of the book?
Yes.
Okay. Your Honor, we can offer this into evidence?
Said straight.
Your Honor, no objection.
Submitted.
Thank you. Okay, can I have this on the screen, please? Can you do this for me? Would you start, show me the first two slides up top along with what's written there. Okay, so the caption on this is show the sequence of events that occur at the muzzle on the firing of a shotgun. Note the large gas cloud that is partially responsible for the severe nature of the wounds in the contact range. So the first A is the shotgun being fired, correct?
That's what it looks like, yes. I didn't
Okay.
read the captions.
What now?
There's captions at the bottom.
Are there
yeah,
captions at the bottom?
So-
Okay. No, I don't think there are, but I'll show you the book.
Okay. Okay, so I imagine that's sequence. Right.
I didn't write the book.
No, that's right. Okay.
So the sequence of a shotgun shell being fired are, the first one is it being fired. The second one, note the large gas cloud that is partially responsible for the severe nature of the wounds on contact. And the third one is at contact range. And then you see on the last one,
I don't see them on my screen.
I'm sorry, okay, go down to the last two. There you go, C and D. You see I guess at the front end would be the pellets and the gas would be preceding the pellets. Is that correct?
No, I don't think that's correct. This is depicting contact range. It specifically says at contact range.
Right.
So pellets are not yet released from the wadding.
Okay, well, we're going to go a little bit further on that in a minute. Let me, referring again to, well, let me ask you this question. If this book says contact shotgun wounds of the head are among the most mutilating firearm wounds there are, you would agree with that?
Yes.
Extensive destruction of bone and soft tissue structures with bursting ruptures of the head are the rule rather than the exception. Correct?
Yes.
These are the wounds of which an individual is said to have had blown his head off, right?
Yes.
In some cases, this is almost literally true. The skull may be largely fragmented and the brain pulpified. Large fragments of the cranial vault and cerebral hemispheres are often ejected from the head. The scalp is extensively lacerated due to two factors: the charge of the shot entering the skull and the gas from combination of the propellant.
Objection to the formal question, Your Honor.
What is the question?
Does this, and one pathologist told me this is the Bible of gun wounds for pathologists, is that correct?
Well, there's a lot of literature, and this is a highly respected primary source. It's not the only. But what are you asking me about?
Does the shot, well, are there two factors which contribute the things we just talked about, the shattering, perhaps even the ejection of the brain? Are there two factors, the charge of the shot entering the skull and the gas from combustion of the propellant?
Okay. Oh, he's actually discussing contact shot
Yes, ma'am.
wounds, and that's not what we have here, but we have similar destruction.
Right. Well, we're going to talk about that in just a minute. But this is about a contact wound. I agree.
Okay.
You have not indicated it was a contact wound.
Correct.
We're going to talk about that in a minute.
Okay.
The shot directly, does the shot on a contact wound from a shotgun directly fracture the skull and shreds the brain while at the same time producing pressure waves that increase the severity of these injuries as well as ejecting the brain tissue?
Yes, it frequently happens that way.
Okay. The gas entering the closed chamber of the head expands rapidly, I make this a question so we don't get objected to. Does the gas entering the closed chamber of the head expand rapidly, adding to the pressure waves, acting on the bony framework of the skull? The only way for the skull to relieve the pressure produced is to shatter.
I would agree with that.
Okay. So, it's your opinion that, well, let me ask you this. If the shotgun muzzle was 3 to 4 feet away, would gas have entered the body?
Well, it's still a very destructive wound. In my experience, there is still a huge amount of energy that would enter the head from a shotgun wound, even if it's not contact.
Okay, and perhaps I misstated the question. Would gas, just a yes or no
Yeah.
be fine, from 4 feet away enter the body and be destructive?
Yeah, I don't know if it's gas that's causing the destruction, but there must be some amount of energy that's causing this destruction, because a shotgun wound to the head, no matter what the distance, causes. But whether it's due to a gas or not, I really can't answer that question. This is not something I've done not experiments like this as in the book.
But this is a book you check for reference, correct?
Well, it's a good source, but I don't know whether gas would be responsible for the destruction of the skull from a few feet away. There is destruction of the skull. I don't know if it's attributed specifically to gas or to other factors. So I really can't answer that. And if he says that, that's fine. But I don't know. He's talking about a contact wound. I can't not necessarily extend that conclusion to what would happen a few feet away. But there is frequently destruction of the head.
I understand that there was massive destruction of the head. I'm just trying to get my arms around the definitive work on one of the definitive works indicates that the most instances, the vast majority, that kind of destruction is caused by gas on a contact wound.
Well, this is a mechanism that he's describing based on experimental data, and I'm a forensic pathologist. I've not performed this kind of experimental data, and nor would I extrapolate from his conclusions about a contact gunshot wound to whether the same amount of gas is produced at a distance.
Well, ma'am, and Dr. Reimer, we can walk through this, but these are based not on some experiment, but actually on people that typically shot themselves in the head, contact wound with a shotgun. Would that surprise you?
Well, these are depictions of shotguns being fired. Contact shotgun wounds to the head cause massive destruction, and a lot of that is from gas buildup.
Okay, now we're on the same page, literally. So it's your position, there's a lot of energy when it's fired from 3 or 4 feet away, hits the shoulder, hits the neck, comes through and hits the head, and the head explodes, correct?
Yes.
And have you had a number of autopsies you've done of victims whose heads have exploded as a result of a shotgun?
Yes,
Okay. And many of those were contact suicide wounds?
yes.
Okay. Have you ever had one, and we can talk about the details of that, where someone was shot from 3 or 4 feet away, no initial contact with the head? You would agree, no initial contact with the head.
Correct.
It goes through the shoulder, the neck, and then the head explodes. Have you ever had one of those?
Yes, these are very dynamic, and he still actually had a lot of his head there. Sometimes with the shotgun, when the entire head is basically, you don't really see very much above like the teeth. So this was, there was obviously horrible destruction of this skull, but his face was intact, and frequently a contact causes fractures of the face. So, I don't see any evidence of contact range discharge on the left side of the neck. So it was not my conclusion, that was not my opinion, that this is a contact shotgun wound.
Well, let's talk a little bit about this. Your position is the energy by a shotgun blast that went through the arm, through the neck, and then up to the brain still had enough energy. Is it the energy caused by, is it pellets going into the brain?
Yeah, well, not just pellets, but there's also fracturing of the base of the skull, which is a bone that holds underneath the skull, and that fracturing with sufficient force can actually push the brain out.
And
So
not
it's
only
a
push-
variety of mechanisms that could contribute to the destruction and the loss of brain tissue.
It not only pushes and fractures the skull, in this case, the brain was brought to you in a separate bag because it ended up laying at his feet. It went up in the air and then plopped down at his feet, correct?
Yes.
Okay. The entire brain.
Most of it, yeah, except for the brain stem.
It's exploded out of his head.
Yes.
And the skull was at least almost destroyed around where you say the exit wound is, correct?
Yes.
Now, you indicated the state did not show you any crime scene photos, correct?
Yeah, I really didn't look at them. Yeah. I mean, they might have said, oh, here, this is a picture of the wall, but I didn't look at them. And they were thumbnail size. So this is a couple of weeks before trial.
Okay, now if you would put back up exhibit number 112, please. No, I don't think, is that 112? That's the chest. I apologize. 113. Can you focus on that area where the pellets are, please? Yeah, that right there. So, at his shoulder, how big a spread is that? As it comes in, is it 2 inches, 3 inches, 4 inches, 5 inches, that wound?
I didn't measure the spread of the pellets.
Okay. So, how about, I apologize to the jury, this is pretty graphic. How about pull up 109? Okay, so this depicts a very big wound in the shoulder, correct?
Yeah, that's a typical appearing shotgun entrance wound.
Okay, and would you come down here for just a second, please? This is state defense exhibit number 109. Have you seen that before?
Yes, this is my autopsy photo.
Offered into evidence, Your Honor.
Submitted.
Would you put it up the screen, please? Now, as we look at this photo, we see this is the entrance wound,
Yes,
and then it goes in here, correct?
that's correct.
So, but this is a much larger wound than the next one in line, is it not?
Well, that's okay.
Well, let me ask you this. In terms of understanding a shotgun pattern, as we saw in the photo, starts out basically the size of the shell, right? If you just answer the question, and then you can explain. Does it start out as the same size as the shell?
Yes.
Okay. And as it goes forward, the pattern expands, correct?
Yes.
Okay. And it continues to expand even after it hits something, correct?
Yes.
Okay. So now please explain to me why this wound, and it looks like it's, I mean, if you use me on my left shoulder, what is the
Yes. I'd be delighted to tell you why this entrance wound is larger than this one, even though what you said is correct about the spread. And that's because the entrance wound to the left shoulder, it's not straight on, perpendicular. If it was straight on perpendicular, then we would have a smaller hole. But this is going in a tangential manner across. So we're not really looking at a perpendicular, entrance wound that's going to make a round hole. So as it's coursing along the top of the left shoulder, we get more of an oblong hole. In contrast, its continuation into the left side of the cheek is kind of straight on at a 90-degree angle. So that's why that is smaller. So there was nothing about this that was inconsistent with what I would expect from a shotgun wound.
So tell me, so you're saying this second hole was made in this direction. Is that what you're saying?
I just said that was a continuation of the logical sequences. It went through here, it's causing a lot of destruction, and then entered the left side of the neck.
So that big wound is because it's in a different direction than the small wound, is your explanation?
At a different angle
Right.
along the surface of the skin.
Okay, and there's no pellets in his face, are there?
There were some pellets that we saw in the x-ray.
But not in his face?
Not in the front of his face, right.
So as it continues on, is there any evidence that it expands even more?
Well, it did cause, there's so much destruction, we can't exactly, have a single, easily tracked path. Because when the skull is involved, there's so much expansion, usually either from gases or just from the blast of the projectiles, that it caused, we can't really track, it caused an exit on the right side of the back of the head with loss of the brain, and lots of skull fractures predominantly on the right side.
Okay. But you would agree with me that wound appears to be much larger than the next wound?
Oh, absolutely.
And one explanation, you have an explanation for that. Could the other explanation be that this is an exit wound and that is an exit wound? Could that be a reasonable explanation? I'm going to show you something in a minute that may assist you in making that decision. But is it a possibility?
Thought would not. That is not. I do not believe this is consistent with an exit wound from a shotgun. There would be a lot more destruction because, it would be coming. It had to be coming from somewhere, right? Somewhere else.
How about a contact wound on the head, on the back, right back of the head? What would you expect to see on the bone structure of the back right of the head if that was a contact wound on the head?
Well, I would not expect the brain to come out. We would have had opening of a lot of skull. We would have had a path through the brain, which is not at all what happens here.
So, if there was a contact wound, and we saw a moment ago, and we agreed that the gas would enter first, explode the skull, the brain would pop out. Did you find any pellets in the brain?
I don't remember if they were from the brain, but the brain was basically intact. A contact wound to the top of the head would cause, a huge defects of the brain.
Right, because the gas going in on a contact wound would create such a pressure, as we just read, that the skull would explode and the brain would pop out.
No, I don't think that would happen from a wound that was going toward the brain from above. I think we would have certainly destruction of the brain, but it wouldn't just pop out because it's in the path of fire. There's going to be massive destruction of the brain. It may end up on the floor, but it's going to be in multiple fragments. So in my experience, doing this for a long time, I do not think that the brain would have popped out the way it did from an entrance wound on the top of the head.
Okay. Now, let me ask you to look at, you put, and this is under seal, and I would also, Your Honor, ask the other photos I put in be put under seal.
They're under seal.
Thank you. Would you put defense exhibit number 59, and I apologize to the jury for the graphic nature of this. Go ahead. Okay, I would like you, do you recognize this?
I've not seen this photograph.
Would you disagree with me that's a photograph of, it's been testified, Paul Murdaugh
It does
at the
look-
scene?
Yes.
And the way he was found? You've
I
never
don't
seen-
know how he was found.
Okay, but this is a photograph you've never seen.
I've never seen this photograph.
Okay, let me get one thing before I ask you questions about it. Okay, a couple things. If you would center on his head and make it a little bit, can you make it a little bit bigger, please? Okay. So do you see a sort of semicircle defect in the skull right here? You see where I'm looking?
Do it again.
Right here?
I do see a defect, yes.
Right, in the skull.
Yes.
Semicircle.
It does have a semicircular.
Okay. Can you determine from looking at the photograph any beveling?
As I said earlier, beveling is not really too reliable when we have so much destruction of the head. But if you're asking me if that could have been a contact shotgun wound to the top of the head with a kind of curved entrance, I would expect to see soot. We always get soot from contact wounds, and it's deposited on the outer table of the skull. So there is no burning, no soot on the outer table of the skull to
Did you
support that.
take an autopsy photo of this area of the skull?
Well, when he came in, I do believe I took an area of the skull, but it may not have caught that.
Okay. Did you shave his head?
No, I did not.
You did shave Maggie's head for a head wound, correct?
Yes.
Okay. And why didn't you shave his head? To examine this, you would agree with me, had his head been shaved, you would have had a better look at this wound.
Well, I believe that my assessment of it was correct, and without usually shaving is along an entrance wound, not an exit wound. So I determined this was an exit, and shaving is not done on exit wounds. I shaved Maggie's because that was an entrance wound, and it gives me an opportunity to see the margins of the entrance defect.
I guess what I'm asking is, you decided that that was an exit wound without shaving the head, without looking for stippling, without looking for so, because you would agree with me that to do that effectively, you'd have to shave the head.
To observe marks on the skin, yes. But
Okay.
also there would be soot on the outer table of the skull.
Well, did you look for it? You apparently had already decided.
Yeah, well, I did look. I didn't take a picture from this angle necessarily. I did take a picture after from the top of his head. But my determination, based on my experience, was that the entrance wound was over here. Doesn't mean somebody else cannot disagree with me. But that's my opinion.
Somebody could disagree with you, and that would be a reasonable disagreement.
Well, I would say that people can disagree, but that doesn't mean that doesn't change the truth.
You would also agree with me, though, that your notes contain no mention of the lack of or presence of stippling or soot on that part of his head. You never looked for it, did you?
Well, I look for it. I look at all of the wounds, and if there was, I would have documented it. But I don't document the absence of soot or stippling on what I determine to be an exit wound.
And I don't see any note of yours where you examined that exit wound in detail. I mean, shaved his head, looked for some distortion that would be inconsistent with the conclusion you'd already come to, correct?
Well, I came to the conclusion based on my examination of the entire area.
Okay, and as this book indicates, the vast majority of this kind of damage, the vast majority, I mean, they say most probably, almost certainly, is a contact wound to the head that injects the gas, which explodes the head. Is that not true?
No, I do think that you're kind of you're extending his statement. He's describing contact gunshot wounds to the head. Actually, a contact gunshot wound to the top of the head like that, like I told you, it would have caused fragmentation of the brain, not ejection of the brain, based on my experience. And then there would be a lot more. We would have a lot more. Fragments. It would never have just left the rest of the skull intact. We would have had fractures of the face. There's massive amount. I don't believe that the fractures of his skull are consistent with that being a contact shotgun wound. I understand that is a massive destruction of the head from shotgun wounds. But in this case, we do have the brain basically left intact. We don't have a path through the brain. It's a very dynamic, there's gases, there's pellets, there's fractured bone. But in my opinion, based on my experience, that was not an entrance wound, and that this was not an exit.
And you indicated, I looked at your autopsy report, that well, first of all, do you believe this was caused by pellets entering the brain cavity?
No, I think it's a combination of different things. I don't think it's from pellets specifically.
What was it?
I think it's from the gas buildup in the brain and fractures of the skull, and that just basically a lot of gas buildup.
So where did those gases come from?
Yeah, it's a huge amount of energy from a shotgun.
I'm sorry. If you'd answer my question, where did the gases you just testified that caused this destruction come from?
From the shotgun wound.
A shotgun wound you testified was created by a weapon that was more than 4 feet away. The gases traveled through the air, traveled through that shoulder wound, traveled through the neck, and then exploded his head.
It's not just gases, but it's a combination of gases and the pellets as well.
But there would have been a significant amount of gas involved to explode his head.
Yes.
And there would be pellets. Would they be present in the brain after that brain exploded?
The brain, the pellets may not have reached the brain. The brain may have been ejected just by virtue of the skull fragmenting and the base of the skull pushing it up. It's not possible for me to say exactly why the brain came out here.
But you would agree with me, based on the literature, it's much more common for a contact wound where the gas goes in, contact to explode the head.
Well, in my experience, a contact shotgun wound could cause this type of damage, but it would frequently cause even more damage. Like a lot of times there's just massive destruction of the entire head. At least the front of his face where bones were intact.
I hear what you're saying is that it would have produced massive destruction, but it would have always included massive destruction of the face.
Okay. Well, let me tell you, there are other reasons that why I concluded that the entrance wounds were here. Okay. We have basically a bunch of tight pellets over here.
Right.
If they would be more spread out. If the entrance wound was here, by the time it got to here, there'd be a lot more pellets over a wider area.
How many more?
Well, it would, no, I'm not saying more pellets, I'm saying there would be a wider spread of pellets. This was still in a relatively narrow range. It was along the top of the shoulder, so.
From my head to my shoulder on a direct line.
Yes.
How far is that?
Well, honestly, the spread would not, I don't believe they would have been as tight along the shoulder. I think and we also would have had a larger defect probably on the.
A larger defect?
Yeah, look.
Between here and here?
Every single shotgun wound and gunshot wound, they're each a little bit different. So a lot of this is judgment and assessment at the time of the autopsy.
Well,
and it's not theoretical whether there's gas buildup or not gas buildup. I can see this as a shotgun wound. We have pellet entrance defects around this large defect.
Okay, pellet. You just told me you couldn't do a bevel assessment on skin. How do you know their entrance rather than exit on the skin?
Well, I'll tell you. And the reason is if pellets are going through the shoulder, we wouldn't have a big, large, oblong defect. We would have holes from the pellets, not an oblong, ovoid defect. So you'll recall on his arm, Paul's arm, those pellets, they came from, and then along here, we just basically have pellet exit wounds. And we don't have that on the shoulder. We have basically a larger confluent wound that was not caused by individual pellets.
Okay, well, let me ask you this then. If you can take that picture down, please.
Yeah. It's not my opinion that is the entrance wound is to the top of
And
the head.
could you put up? No, we don't even need to do that. I don't need to see the picture. The chest shot goes through his chest, comes out under his arm, right?
Yeah, on the left side, yes.
The left side comes out under his arm. And what do we have? What do we have on the inside and outside of that arm?
We have pellet.
Coming in and out. We have a pattern of pellets.
Yes.
Just like the pattern of pellets that you're talking about on what you say the exit wound here. Exit wound from about the same distance, pellets. From the same distance, pellets. Correct?
Well, there are pellets in the shoulder.
Yeah.
We have a ovoid defect at the top of the left shoulder. They're not a bunch of individual pellet wounds. We have pellets embedded in the tissue, but the actual defect, we don't have a defect like that on his arm, even though it may be the same distance. And the reason is because the pellets are exiting, but each one is going through the left arm individually. Okay. Whereas if this was the entrance at the right side of the top of the back of the head, it's a good thought. Let's think about this. And it was coming through the head, regardless of what happened to the brain, and then exited here and then went along here. We would have a lot more individual pellet wounds on the shoulder as opposed to a large, huge, big area of skin and subcutaneous tissue loss. Pellets don't cause that type of damage on their own.
So you and I both counted something between 30 and 40 pellets in that shoulder wound a little while ago, right?
Yeah, there were something like about that.
Do you know how many pellets are in a duck shot or bird shot 12 gauge shell?
No, I don't remember.
So you don't know whether that was 90% of the pellets or 60% of the pellets or 50?
No, I do
Does
not.
that make a difference to you? How many of the pellets that were fired ended up there?
No.
But you're saying just because the wound here is bigger and the wound in his chin is smaller doesn't mean the shotgun pellets spread out, right? They spread out and they don't contract. You would agree with me? Just please
I don't
answer-
really
please
know
answer.
whether to agree with you because I'm not understanding your question.
Okay, let me rephrase it. If you view that wound on his shoulder as the entrance wound, and I believe you have,
Yes.
you would agree with me that it is, whether it's coming across the top or whatever, it is a bigger wound than the wound in his chin. In other words, the are you saying that those were so focused that they, as they went through or across the top, they actually contracted?
No.
Okay.
I explained that this was larger because it was tangential across the top of the shoulder, so
But
that's the kind of.
You agree with me that reasonable people could have a difference of opinion about these facts?
Yes.
Okay. Pardon me. Give me just 2 seconds to make sure I put everything in the evidence I want in. Spread everything out over here. I'm going to leave the rest of this until after this examination, if that's okay with the board. Thank you.
Thank you, Your Honor. May it please the court. Your job is to do what? What do you do?
I do an autopsies in order to determine the cause and manner of death.
And when you're asked to do an autopsy, are you told any sort of conclusion to come to, or do you just look at the evidence in the body before you and come to whatever conclusions that body tells you?
Yes, and I examine the body and I come to a conclusion based on reasonable medical certainty based on my education and experience.
So is it part of your job to look at crime scene photos and that sort of thing, or are you relying on what the body tells you?
My job is to look at the body. That's my job. Crime scene photos, crime scene evidence, it's somebody else's project. That's not incorporated into my conclusion.
I want to talk a little bit. We've gone into a long examination about the top of the head, and you talked about soot and stippling. So I want to make sure the jury understands the difference between the two. You saw stippling on the chest wound to Paul, is that correct?
Yes.
All right. Explain to the jury the difference between soot and stippling and what that tells you and what it doesn't tell you.
Okay. So the stippling is like the pieces of gunpowder that deposit on the skin when something is fired within 2 to 3 feet from the barrel of the gun, not the shooter, from the barrel of the gun. Soot is like real burning powder, burning marks from very hot gunpowder that's still basically burning, and it causes like a burning wound. That's the soot, and we don't see soot except within a few inches, depending on the gun. But we would like not expect to see soot further away from 6 inches. So the fact that we have stippling but no soot, we can fairly say it's not closer than 6 inches, even though I know it's most likely within 3 feet.
All right. So you observed stippling on the wound to the chest for Paul, correct?
Yes.
Did you observe stippling anywhere else?
No.
All right. Did you observe any soot at all on Paul's body?
No.
And did you, particularly on the top of the head, did you observe any soot there?
No.
You were asked a little bit, and you had testified yesterday about the tilting of the head and the manner in which the shotgun blast went through the chest, through the shoulder, into the neck, and then out the top of the head.
Yeah, I think that's a reasonable conclusion.
Right. And that still is your most likely conclusion, is that
That's
correct?
my most likely conclusion,
All right.
to a reasonable degree of medical certainty. It
So
doesn't mean it's 100% the only thing, but that's my opinion based on my experience.
All right. And how many autopsies have you done?
Approximately 5,500.
And how long you been doing this?
20 plus years.
Okay. Dr. Reimer and Professor Reimer, correct?
Yes.
You were asked about the book, and all that discussion that the defense counsel was talking to you out of the book, that was dealing with a contact wound, correct?
Yes, I mean, I'm not going to disagree with a book, but the discussion is regarding a contact shotgun wound.
All right. And when your expert opinion, to a reasonable degree of medical certainty, you saw no evidence of a contact wound in this particular case with Paul, is that correct?
Correct.
Now, you were asked a lot, and let me ask you this. A lot of what was in that book, when they're talking about those contact wounds, they're exploring someone using a shotgun to commit suicide, correct?
Well, frequently contact wounds do indicate a suicide, but potentially people can be shot by another also at contact range.
All right. And your manner of death that you determined for Paul to a reasonable degree of medical certainty was what?
Homicide.
Homicide, which means?
Death at the hands of another.
All right. And did you see, with this shot to the chest or the shot that went through the shoulder into his head, any evidence whatsoever that this could potentially be a suicidal wound?
I do not believe that it was at all consistent with the suicidal wound.
To a reasonable degree of medical certainty?
Yes.
In your expert opinion?
Yes.
Let's talk a little bit more about the head wound. And you've been asked a lot of questions about the possibility that this was a contact wound from the top of the head. Is that correct?
Yes.
And your opinion, to a reasonable degree of medical certainty, is that it is not?
It was not.
Okay. And let's talk about, just very quickly, without belaboring the point, some of the reasons. First of all, you saw no soot, correct?
Correct.
And then also, with the damage inside Paul's head, did you see any evidence that would indicate that the force...
Your Honor.
Did you see any evidence that would indicate to you, from the damage that Paul suffered, that the force of the shot was going this way as opposed to that way? Going down from the top of his head as opposed to going...
I don't believe that it was going from the top of his head down. I don't think the damage to the head was consistent with that.
Okay. And with the brain, you said that the brain came to you in a separate container. Is that correct?
Most of it.
All right.
Yes.
And did you, in examining the brain, did you see any evidence whatsoever that would have been consistent with the force of the shot, including the pellets and everything else, going into the top of the head and into the brain that way?
No, I did not see any evidence of that.
To a reasonable degree of medical certainty?
Yes.
Did you find any wadding in Paul's head cavity?
I don't think there was any wadding.
You were asked a lot about the shoulder and how it was, in the picture you were shown, it was more, in that picture at least, it was kind of a gaping sort of wound. Is that fair to say?
Yes.
Okay. And his shoulder, was it kind of squinched up in that picture a little bit? I don't know if that's a technical term, squinch, but...
You mean the photograph?
the photograph that you were shown.
Well, I took a picture of his the shoulder area. Yes.
Okay. And just so I understand, as opposed to a direct-on wound and the sort of the size of that, and then a wound that goes along the side of the shoulder, like you identified in this case, explain to the jury again how those are going to create different shapes of wounds.
Yes. So,
Not in response. He's asking her to explain again. That would be repetitive.
I sustain the objection.
Was the wound to the shoulder, was that straight on or oblong to the side?
yeah, it was a tangential type of shotgun wound.
With that shoulder wound, that you've identified that as the entrance wound, the initial wound,
Yes.
would you still expect to find the pellets in that wound consistent with what you saw in Paul?
Yes.
Thank you, Dr. Reimer. Nothing further.
Yes. Questions. I want to make sure I understand a couple of the answers you gave to the Attorney General. We previously established you did not see any real crime scene photos in this case.
Correct.
In many crime cases or some crime cases, do you look at crime scene photos to help you or assist you in your opinions concerning certain things on the autopsy?
No, honestly, I don't. It's my job to examine the body, and I come to my conclusions, and I don't really, look at the crime scene photos. I could potentially ask for them if I saw something very unusual, and I'll say, wow, how did that happen? Or sometimes I'll see an entrance gunshot wound that has, I'll assess it. There may be a lot of glass around it, and I'll say, well, did this go through a window first? And I'll ask that question. I don't necessarily have to look at the photos. So there is information that I might ask, but, looking at the crime scene photos is really, not something that I do to help me come to a conclusion. Whatever's on the body, I will rely on what I see on the body, and if it fits with the crime scene photos, fine. But if not, I have my conclusions based on the body.
As you just conceded, you do occasionally ask to see crime scene photos. Occasionally.
No, I don't ask to see the crime scene photos. I will ask to see, ask if something, like I just recently had a victim of multiple gunshot wounds, and I thought she may have been sitting in a car. Nobody told me anything like that because there was a bunch of glass fragments kind of on it. All the entrance wounds were to the left side and all the exit wounds were to the right, and then there were like fragments of glass and kind of car parts, banging into the skin. So I was like, was she in a car? But I don't ask to see the photos. Really, I don't, it's not part of, my evaluation of the cause and manner of death, doing an autopsy.
But like in this case, you had conversations with investigating officers, did you not?
At their request.
Did you have a conversation with SLED Agent Owens about the bruising on her calf?
Well, I did not actually observe that at the autopsy, so I really couldn't come to any conclusion. And it's very possible that that was dirt from a shoe that was already gone by the time it came to me. I'm not autopsying the bodies at the scene. There's, there's transport, there's movement into a body bag, but it may have been asked to me, but I distinctly said I didn't see that.
But you did have a meeting after the autopsy, and your report, with, I believe it's Lieutenant Owens with SLED, the chief investigating officer, and discussed did he show you the muddy print?
Objection beyond the scope.
Objection is sustained.
Okay. Well, I think that's probably all I have. Thank you so much for being here
sure.
today. But an opinion is an opinion, right?
Yes.
Thank you.
Ladies and gentlemen, we'll take a break for about 15 minutes. Please do not discuss the case.